Hah? Apa? और उसको कल
Rupa Malaysia.
अरे मेरा स्पीकिंग दिखा रहा है, इजी स्पीकिंग अब म्यूट नहीं है क्या? नाम क्यों दिखा रहा है?
Chairman Dr. R.S. Dubey sir, that he allowed us to go with this big program or workshop today. So on behalf of Samarpan, I welcome our today's speakers, Ms. Anu Grover ma'am. Ma'am is officiating director, Simulation Lab Training Officer, National Reference Simulation Center, Associate Professor, Faculty of Nursing, SCT University, Gurgaon. I request Priyanka to welcome ma'am. Thank you so much. Now I request our chairman sir to welcome Dr. Binu Joy sir. Sir is the principal, Price College of Nursing, Price Hospital, Rajkot, Gujarat. Sir is our second speaker today. Welcome you sir. Thank you so much for accepting our invitation in the short period. Thank you so much. Now I request our director Dr. V.P. Tiwari sir to welcome Professor Dr. Priscilla Johnson, Principal, Era College of Nursing, Era University. Thank you so much, ma'am, for coming in our university. Thank you so much and welcome. Now I request Miss Pooja to welcome Naveen sir. Mr. Naveen JS sir is the Vice Principal College of Nursing GSBM Kanpur. Government Nursing College Kanpur. Welcome sir. Sir is our chairperson for today's session. Now I again request Priyanka to welcome Dr. Santosh Asu. Sir is Associate Professor College of Nursing, Jhansi. Sir is also our chairperson today. I also extend my welcome to Dr. Jagdish. She is here, the Principal Anklet College of Nursing. Welcome, sir. And other principals, faculties, and students from different colleges. Welcome you all for such a wonderful workshop that is on simulation-based nursing. Today we will learn what is simulation, why it is important in nursing, why everyone is behind now with this simulation. So today the skill session also for 3 things outside of the hall, that is on IB section, then I think IOCD, and the third one is NVR. So today we'll enjoy this session also. Thank you so much and welcome you all. Okay, sorry. Today we are having Dr. Namrata Avasthi. Madam is professor in pathology in RML. We welcome you, ma'am. Thank you so much, everyone. Now the time is for the session. We'll start the first session today.
Thank you, ma'am. I would like to call our director, sir, SAMARPAN Group, Dr. V.P. Tiwari, to illuminate the audience with your wise words. Sir, please.
Dr. Dubey, Chairman SAMARPAN Group, distinguished VIP, Dr. Dinu Joy, Madam Grover, Professor Kaslam, Jagdish sir, Santosh sir, Naveen sir, other principals from different colleges of nursing in UP, principal assigned PS and our faculty members, students. चूंकि टाइम कम है, मैं बहुत ज्यादा समय नहीं लूंगा, मैडम ने आपको बता दिया है, सेशन ऑलरेडी लेट हो चुका है। जो भी चीफ गेस्ट और गेस्ट ऑफ ऑनर थे, चूंकि गवर्नमेंट में अपनी प्रायोरिटीज होती हैं और जब सीनियर्स बुलाता है तो जूनियर मना नहीं कर पाता है, क्योंकि हम उस सर्विस से गुजर चुके हैं। तो दे विल जॉइन अस इन बिटवीन। द टॉपिक इज वेरी क्रूशियल, simulation in nursing. We all know, like in other education, in nursing education also there is a large gap between theory and practice. And when students pass out from the college and go for the professional service, they are unable to perform to the best of ability which is required from those nursing professionals. And for that, this is also a teaching technique where we create a real world environment in a controlled condition and give the practice to the students, so that after pass out, if they are going to hospitals, then they can perform better when there are critical patients, other things. I need not to go detail because experts are here, because basically I am also scientist from the modeling technique. So I know about this because we have applied this simulation modeling in physics and forestry also. Similarly, you are also having here high fidelity manipulation, medium fidelity, low fidelity, even hybrid simulation. Patients also where volunteers perform the role of a patient. So there are many techniques. I am sure that all those techniques will be displayed here. And Madam Grover is here, so everybody knows that is the only national reference simulation center where all our doctors, nursing professionals, potentials and limitations. Here we have one simulation technique where students are free. They don't have this problem of the live patient. So they can perform better, they can learn things better. But at the same time, what happens in emergency? We cannot create all these situations in a controlled condition. So ultimately, then they have to modify themselves when they are going for the service. So whatever they are learning in the simulation, when they go back, then they have to apply those techniques in the hospitals. So I am sure that the students coming from various nursing colleges from different districts of the UP, even we have the online broadcast of this workshop. There are many students and faculty. They are joining us through Zoom link from the different states of the country. And I am sure with the lecture and presentation given by Ms. Grover, Professor Priscilla, Dr. Bino Joy, all will be benefited and they will be able to perform their duty more efficiently after going through this workshop. With this, I am my word and I convey my best wishes for this workshop. Thank you very much.
Thank you, sir. Now I request founder of our SAMARPAN group, respected Chairman Sir Dr. R.S. Dubey, to grace the dais and speak few words.
इस सभागार में उपस्थित सभी आदरणीय मैम मनु ग्रोवर, डॉक्टर बिनी जॉय, डॉक्टर कृष्णा सेवन, संतोष जी, सभी प्रिंसिपल्स, वाइस प्रिंसिपल्स, फैकल्टी मेंबर्स और दूर दूर से आए आप लोग डिफरेंट स्टेट से आए हैं, मैं आप सबका यहाँ स्वागत करता हूँ। मुझे आज अपार खुशी हो रही है। कभी कुछ दिन पूर्व, कभी कुछ महीने पूर्व डॉक्टर दिव्य शुक्ला और डॉक्टर तिवारी मेरे पास आए कि सर ये कॉन्फ्रेंस करना चाहते हैं। तो उसमें थोड़ा मुझे हिचक था कि क्या ये सफल बना पाएंगे, क्योंकि इनका पहला प्रयास था जिसके लगातार मैं इनसे कहता आ रहा था। लेकिन आज मुझे देख अपार खुशी हो रही है कि आप लोग इतनी दूर दूर से आए हैं, इतना पेन लिया, बच्चे भी आए हैं, डिफरेंट कॉलेज यूपी से आए हुए हैं। तो मुझे आज रियली बहुत ही अपार खुशी हो रही है। इसके लिए मैं अपने प्रिंसिपल डॉक्टर द्युति मैन और अपने डायरेक्टर डॉक्टर दिव्य तिवारी की पूरी सराहना करता हूँ और आप सबका आभार व्यक्त करता हूँ। निश्चित रूप से जिस तरह डॉक्टर तिवारी ने कहा, महोदय ने कहा, आप सभी जानते हैं इससे बहुत ही ज्ञानवर्धन होगा। और मैंने हमेशा प्रयास किया है, आफ्टर माई रिटायरमेंट फ्रॉम गवर्नमेंट जॉब, आई वाज डायरेक्टर ऑफ RML हॉस्पिटल लखनऊ फॉर सो मेनी इयर्स। उसके बाद आफ्टर रिटायरमेंट आई स्टार्टेड दिस संस्था विद द होप ऑफ समर्पण, just to dedication to society, to provide best nurses in this field. That's my aim, and I always said and requested to all principals so far before Dr. also कि हम सब इसमें प्रयास करें और बच्चों को अच्छी अच्छी ट्रेनिंग दें जिससे कि वो प्रैक्टिकली पेशेंट्स पे अच्छा परफॉर्म कर सके। और इसमें सभी ने, हमारे सभी फैकल्टी मेंबर्स ने, हमारे प्रिंसिपल ने, हमारे स्टाफ फैकल्टी जो भी नहीं आ पाए हैं, जैसा कि बताया कि डॉक्टर साहब नहीं आ पाए, डॉक्टर साहब लेट हो गया क्योंकि नौकरी है, नौकरी में ना करी एक वर्ड होता है, ना करी, यू कैन नॉट से नो, सो दे विल कम एंड जॉइन इन बिटवीन। वापस समय नहीं लूंगा। और खासतौर से मैं प्रोफेसर नम्रता अवस्थी जो मेरी बेटी भी हैं, आर्मी इंस्टीट्यूट में है, मैं उनका भी आभार व्यक्त करता हूँ, उन्होंने अपना समय निकाल करके आज यहाँ आई। बस मेरी ये आप सबसे अपेक्षा है कि आप जितना भी ज्ञान आप यहाँ बटोर सकें, इकट्ठा कर सकें, उसको लेके जाएं। और मैं डॉक्टर तिवारी और डॉक्टर शुक्ला से पुनः कहूंगा, आने वाले गेस्ट मेंबर से कहूंगा कि ये लगातार कुछ महीने बाद होना चाहिए, ये मेरी अपनी इच्छा है। प्रैक्टिस मेक्स मैन परफेक्ट। इसके बाद मैं कुछ नहीं कहना चाहता हूँ, फिर समय बहुत कम है, आपको ज्ञान ज्यादा करना है। धन्यवाद।
Thank you, sir. So now we are going to start our first session. Topic for the session is simulation in nursing. It will be my pleasure to invite Ms. Anu Grover ma'am on the stage as a resource person of the session. I request volunteers to escort the guests, please. Ma'am is officiating director, simulation lab training officer, National Reference Simulation Center, Institute University, Gurugram. It will be a privilege for me to invite Mr. Lavina Jej on the stage as the chairperson of the session. So please come on the stage and occupy your honorable seat. Thank you, sir. Thank you, ma'am. Before we start the session, I would like to introduce our chairperson for the session, Professor Lavina Jej, currently working vice principal in Government College of Nursing, Kanpur, and also PhD nursing scholar from Amity College of Nursing.
Don't waste time.
Introducing our chairperson, sir, Professor Lavina Jej, currently working as a vice principal in Government College of Nursing, Kanpur, and also PhD nursing scholar from Amity College of Nursing, Amity University, Gurugram. Sir has earned Master of Nursing degree in Community Health Nursing from Srimati Narayani T.R. Karibangala College of Nursing, Hassan, Karnataka, India in 2010, and in 2006, he completed his Bachelor of Nursing from Bapuji College of Nursing, Devanagar, Karnataka, India. Sir has received gold medal for rank 1 in MSc Nursing from NDRT College of Nursing. Sir is having 14 plus years of teaching experience in nursing. Sir has published 26 research papers in International Journal and 4 papers in National Journal of Good Impact Factor. He wrote 2 books and owns 4 patents, 1 design and 1 copyright in his name. Sir has worked as a NAC coordinator for a period of 2 years in Amity University, Gurugram, and bears sound knowledge in all criteria of NAC. He reviewed many nursing books and is working in editorial team for 5 major nursing journals. He is associated with 8 nursing associations in India and actively participating in uplifting the quality of nursing profession. He received Bharat Jyoti Sri Guru Rashtra Samman Award from MTLA Trust India. He received Best Research Paper Presentation Award for my research and eye donation during National Conference on Transition Leadership, Leading Change at Shraddha University, Greater Noida, UP. Sir has received many awards for MSc Nursing distinction from Avopa, Devanagar, Karnataka. And lastly, he organized various national and state level conferences, workshops, webinar, and FTP, and also presented research papers. So welcome you, sir. Now I request sir to introduce our speaker. Yeah, Anu Grover.
Good morning, everyone. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara. Guru Sakshat Parabrahma Tasmai Shri Gurve Namah. by remembering all my teachers, mentors, guides, and all the gods. So I'd like to introduce myself, Professor Navina JH, and I'm hereby in front of you to introduce today's speaker for the simulation. And first of all, heartily congratulations to SAMARPAN Institute of Nursing Sciences. It is like my second home. I used to visit college many times, and my dearmost colleague in past college, Dr. Deepthi Shukla Madam, we worked together. We try to uplift the nursing profession by bringing a lot of changes in the Samarthi University Meerut, and so we somehow succeeded. So that was my great experience working with Madam. Afterwards, still we are connected because nursing is a small world. We used to meet each other. And I'd like to say congratulations for all of you people, students and college for organizing such a beautiful annual workshop. And I would like to thank the management of SAMARPAN Institute of Nursing Science, Dubey sir, and other distinguished guests, and also Dr. Vinu sir, Dr. Santosh sir, and Madam from Era College of Nursing, Jagdish sir, and many college principals and vice principals for this session. So I take an opportunity to introduce today's first speaker, Ms. Anugrova. So Ms. Anugrova Madam is working as an associate professor and officiating director of National Reference Simulation Center, SGT University, Masters in Optics and Renovation. आप सब लोग जानते हैं हम लोग मतलब everybody would like to go to Kashi, Varanasi, and everybody would like to go to Jerusalem and Mecca. Same like that. All nursing professionals would like to visit SGT University because it is our like INCS recognized SGT University. They would like to see there because many mannequins are there, many experts are there, and from that knowledge, like आप लोग जानते हैं जब हमारे देश पुरातन समय में नालंदा and तक्षशिला जानते हैं आप लोग? So it was the universities and it was the knowledge center for not only India, all over the world. People, scholars, पंडित, महान लोग वहां से आया है और हर जगह में जाके knowledge spread किया है. Same like that we can compare. So from that you are fortunate to have the Anugrova Madam. She is having 10 years of teaching experience, including 3 years of simulation, and also she is working as an associate professor at Faculty of Nursing and master trainer of simulation-based education methodology. She trained 455 nursing faculty across India and abroad in 19 batches organized by Indian Nursing Council. In the state, one teacher taught, he or she will teach 1,000. You just multiply 455 into 1,000, so you will get n number of nursing professionals who are taught by Madam. So master trainer of capacity building of midwifery faculty model to train 310 midwifery faculties across India and abroad in 14 batches organized by Indian Nursing Council in collaboration with UNFPA. So anybody can tell UNFPA? What is UNFPA? Let's check the IQ and GK. What is UNFPA? Raise your hands. No answer. UNFPA. By the end of the session, you have to find the answer. Okay. Instructor for American Heart Association, certified basic life support and advanced cardiac life support. Training Center Coordinator of International Training Center, SGT University of American Heart Association. Then organized various programs at National Reference Simulation Center like Neonatal Resuscitation Program India, induction training of new nurses in obstetrics and gynecological nursing, American Heart Association, certified basic life support, compression only life support training for non-teaching and general public in community first aid training for non-teaching staffs of SGT University. And she attended various workshops and conferences at national level. She delivered talk on simulation in various national and international workshops, webinars, received a grant from Indian Council of Medical Research to train the community as nurses on the skill and simulation training on Planned Parenthood. Total 14 publications, including the review articles in national and international journals, including Scopus Index, briefed about simulation methodology to various national and international delegates at National Reference Simulation Center, SCT University. Many things are there to read about Madam, her achievement. So let's start the knowledge sharing, and I'd like to welcome Madam to teach our students. And so I welcome you from my heart and bottom of the heart and all the students. So thank you for coming.
Now, Sunny.
मैम अपनी पीपीटी खुद चलाई, मैम ने बोला अगर कुछ हो तो आप देख लीजिए।
कैसे देखेंगे मैम, हमें लाइव चल रहा है, एक तो लगाओ कॉन्फ़िगर में।
Very good morning to one and all gathered here. So first of all, I would like to say thanks to Sir for the brief introduction and lovely words of wisdom. Thank you so much. And next, I would like to congratulate first of all SAMARPAN Group of Institutes, Chairman Sir, Director Sir, Ma'am, Deepti Ma'am, and all the faculty members, because it's not without the team you can't work, right? It is always when you say you're working hard, you're working with the team. It's not a one person can go ahead with the long things we are planning and long journey we are achieving, right? So I'm welcoming each one of you, the students, the faculty from different institutes, and I'm welcoming all my delegates here, my chairperson, and my speakers today for the this national workshop. That is the first annual workshop, I say. So that is a big congratulations, each one of you. And second thing, I would like to thank Dr. Deepti Shukla for inviting me for this beautiful topic that is the need of the hour. It is a talk of the town these days. We say simulation in nursing. So it is the need of the hour. I think everyone, not only the faculty, every student, because they are going to be the faculty in few years ahead, that is very, very important for everyone to understand what is simulation. And that is the opportunity I could get. I'm being humble for this. And thank you so much for the invitation, ma'am. So not taking much time, I would like to start with my topic. So first, I would like to know, why do you think simulation is required these days? Any one of you? What is the need? Why there is a need of simulation? Anyone? Because this is my topic. I'm going to talk why there is a need of simulation. So I would like to know from the group first. Any teacher, any student can talk on that. What is the need? Do you think why there is a necessity that we are talking these days about simulation, and everyone is behind this simulation these days? What do you think? Yeah.
Simulation need to improve your knowledge and learning.
Practical knowledge and theoretical knowledge. That is why we require simulation technique to students, so that patient safety must come out, and students may find get their confidence and comfort by studying.
So much, well, lovely answer. Patient safety is our main thing that we have to acquire. We should know that without harming anyone, if we can learn something, that is a big thing, right? That is a simulation. So if you see in the PPT, it is a process used to reproduce an event. We are reproducing the event which is not actual, which is not a real, but we are reproducing it as real as we can, that we can just learn the things before it actually happens in the clinical scenario. So simulation is all about that we are replicating the real world complexes where we can
learn the things multiple times by doing practicing, because we have to ultimately achieve the patient safety, and our patient safety is our main goal. So that is actually a simulation. So we should not forget that simulation is not about that we are replacing the clinical things. Clinical is equally required. I'm again mentioning simulation is not the replication, or it is not a replacement of the clinical scenarios. It is not the replacement of your clinical learning. Without clinical learning, you are not supposed to earn a degree, right? So simulation is just an addition, that before you are meeting an actual patient, where you can reduce the errors, where you can reduce the problems the patient can face, because we are learning on the patient. So when you are learning on the simulated environment, on the simulated patients, definitely your confidence will build up, your morale will build up, and you are able to learn or do the things in a more confident manner when you are actually dealing with the actual patients. Do you all agree with this? Right. Okay, I would like to ask one question to all the students, not to the teachers. How many of you would have the dare to say the truth here? Raise your hands. Who has a dare to say the truth? वही हाथ खड़े करना जो सच बोलेगा. Okay, only 1, 2, 3, 4, 5. Not a question. Not a question. This is just I want to know something. Not a question. Don't worry about your general knowledge or nursing. I'm not going to ask anything. Nursing nahi padh rahe abhi hum. So there are only 10 to 12 students. Okay, I would like to ask the last bencher. Okay, the girl is standing at the last. So how many of you are wondering that how much time I'm going to take on this stage? How many of you are wondering that how much time I'm going to take on this stage today? किस किस को जानना है कि मैम कितनी देर बोलेंगे? सबको. Because everybody is wondering that अब एक टीचर स्टेज पे आ गया, पता नहीं कितनी लंबी क्लास लेगा, कितना लंबा पढ़ाएगा, and everybody is looking और कितनी स्लाइड्स लेके आएंगे मैम, है ना? Everybody is looking for that? Yes. Yes, ma'am. So there are some people who have dared to say the truth. That's why I asked, please raise your hands who can say the truth. So I have only 24 slides, so don't worry, I'll not take much time of yours. So I'll be taking not more than 40 to 45 minutes. So just concentrate and be discussive in my class. Okay? So shall we go ahead? Yes, okay. So can I have the... So what I'm going to talk on here, my outline is learning model. What learning model we are using in the simulation lab? The second one is what simulation is. I think you have lots of idea about simulation, but let's discuss more about it. Why there is a need of simulation? What is the need that we should go for simulation before we are going to the clinical area? What is the process of simulation? What is the experiential learning cycle? Last but not least, why simulation is. So we are going to talk on these topics. So can I have the change in the slide, sir? Okay, so this is our learning model. If you see in this learning model, this is a circle of learning. So the one circle of learning who have come to us at National Reference Simulation Center, it has been changed and upgraded with another 6 components. The next component I'll be talking. The first one is knowledge acquisition. Whenever students are coming, whenever you have come to SAMARPAN Institute, you have been put it in the classes. You are putting your students in the classes, theory class. After theory class, they have been sent for the labs. They are clinical labs, that is in the college area, that is in the institute area, where they are competent in, they are enough skills they have been taught, right? After this, they are going to the understanding of the critical thinking. Do you really think critical thinking is required for us as a nurse? Yes, ma'am. Why do you think so? Because we are there to follow the orders by the doctor. Is it so? Yes, ma'am. Yes, ma'am. We are here to follow the orders by the doctors. Why so? We are doing the medications what doctor is prescribing. We are checking the diagnosis that doctor is prescribing. Then why we are saying that we are taking the decision making skills there? Why do you think so? Because sometimes we need emergency. Yes, very good. So it is not always doctors are with the patients. It is always we as a nurses. As a nurse, we are always with the patient like their family members. So it is not about that if doctor is not there, we are not able to take the decision. So critical thinking and decision making is equally important for everyone, especially in the need of any emergency. And it is not always in the need of any emergency. If doctor has prescribed something, we have to justify that why we are giving this medication and why we are taking this thing ahead. So it is critical decision making is at every step. It is very much required for our nursing students to take care of. So that is why that is a third component we have inculcated in this learning model. So once my students are well versed with the knowledge, they are good at their skills and they are good at the clinical decision making. What we are doing? We are putting them in the simulation environment. We are putting them in the simulated area. So when you say simulation, simulation is not about we are teaching something. Simulation is we are putting them in the situation where they are going to manage themselves. We are not dealing the theory, we are not teaching the skills, but we are just understanding their promptness. We are just understanding how they are going to manage the patient with the cardiac arrest, how they are going to manage the patient with some of the any other emergencies. That is called simulation. So whenever you're putting your students into the simulation, it is not only one person. That's why it is called simulation in teams. So you're managing a patient with your senior nurse, you're managing a patient with their relatives, you're managing a patient with your doctors or any junior person. It is not only you and a patient is being managed when you are running a patient and when you are dealing a patient in the clinical area. Do you understand? So it is very, very important to understand this. When we are in the clinical area, it is not we and the patient, it is we and they. When you say they, their relatives, the doctors, the coordinators, the senior nurses, many more. So when you talk about simulation, simulation is always about in teams, not individually. So when you're learning the knowledge, you are all alone. When you're learning the skill, you are all alone. When you're learning the clinical decision making, you are all alone. But here you're in simulation, you all are together as an interdisciplinary team. So that is very, very important for you to understand that why simulation in teams. So once my students are confident, they have gone through how to manage the patient with the cardiac arrest. Now they are ready to go to the clinical area. So when they are going to the clinical area, they are more confident, they are more competent, they are more happy to share the patient, to share the knowledge with the other colleagues, to share the knowledge, to understand the patient situation, and they are able to manage the situation in a more confident manner. So once these all 5 components have been done, it's really, really important to
भाई
understand
वीडियो क्लियर नहीं आ रहा, वीडियो क्लियर करिए.
and how stimulation has been held. And that's the way the learning model, the circle of learning goes in the end. So that is why if you see the circle goes broader and broader and there's still arrow is there. So that arrow means knowledge is a continuous process. It is not my knowledge ends there. So I'm learning everything. Now again, I'm learning some new knowledge, I'm implementing new knowledge, and I'm taking care of the patient with some new information in a better way. So that is all about the learning model. So next is, so who is she in the picture? Who is she in the picture? So when you say simulation, simulation is, what do you feel this room looks like to you? There is one trainer of mine. This is Mrs. Ritu Yadav. She is with me at National Reference Simulation Center. So this is our simulated area. So this is not an actual setting. So when you say simulation, if you see the person in yellow saree, Dr. Dipti Shukla, she is standing there. She has done that simulation there with their colleagues, with their participants, with their delegates who came across during that 6 days. So it is like we are replacing the simulation in a way that it should look like a real scenario. So can I have the slide, sir? So simulation is what? Simulation is an artificial representation. When you say artificial representation means artificially there is a representation of the actual scenario. Does it look like an actual room? Does it look like that the articles are there? There's a patient on the bed. Can you see the patient on the bed? So there the articles are there. So that means it is controlled environment which we have taken in our hands, where we are looking for the artificial representation of the clinical scenario, but with sufficient fidelity. So sufficient fidelity means what? I would like to know what is sufficient fidelity. How many of you know what is the word fidelity? How many of you know the full form of Wi-Fi? Everybody uses, right? Everybody uses Wi-Fi. How many of you know the full form of Wi-Fi? Nobody is going to check their phones. What is Wi-Fi? Wireless fidelity. So what do you mean by fidelity there? What is the fidelity? What is the fidelity? Anyone? Sorry? connections, connection of
modulating strength.
okay, can say in that meaning. So what is the fidelity dictionary meaning? Any one of my colleagues here sitting in the front rows? Santosh sir, would you like to say something on the fidelity? Yeah. Okay, that is in the nursing ethics, you can say. That is the ethics in nursing, that is right. That we are trustworthiness towards a patient. That is the fidelity, veracity, anything, right? Anybody about the fidelity? So fidelity is sufficient realism. Realism is you are trying to make the things real. So when you say fidelity, that means it is real something. It is not about I am running a scenario on a patient with road traffic accidents and I am coming as a patient with sari. Does it look like I'm a patient? No, I would not look like a patient. So fidelity is when you take a simulation, artificial representation of the area, but with sufficient fidelity where you can increase your realism towards the students, where students feel that they are in actual scenario with the actual patients. So the patient on the bed, she is actually labor pains. Can you see her expressions? Are you able to see the expressions of the patient in the picture? So that is fidelity is maximum realism. So when you talk about simulation, artificial representation, everybody understands. But it is really, really important to create the maximum realism of the scenario where you can take the things that we are creating the things in a more real manner so that we can make the simulation as a real scenario. Do you all agree? Understood? So next, please. So what do you think? Simulation is technique or technology? How many of you, please raise your hands. I'm asking from the teachers only, not from the students. How many of you understand or agree that simulation is a technique? Only teachers. Only teachers. This is the question for the teachers. How many of you agree that simulation is a technique, not a technology? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. So why do you think simulation is a technique? Why do you think so? Why do you think simulation is a technique? Are you okay? Can I have the previous slide? Are you able to see any simulated patient there? There is a patient, right? That patient is a normal human being. Are you able to see any mannequin there? No. So that means what? We don't have any technology there, but still we are running a simulation. So simulation is all about a technique. How to run a simulation. Simulation is not to do anything with the technology, but I must say, if we have a technique, we have a technology that is cherry on the top. We all agree? So definitely, if we have a simulated environment, if we know what is the process of simulation, if we know what is the technique of simulation, and moreover, we have the sim mom who is always pregnant, that is a mannequin, the name of the mannequin, that is the cherry on the top. So we are running a simulation technique with the help of technology so that we can give maximum or sufficient fidelity to the students so that they can immerse themselves into the real situation. But that is artificial. Do you all agree? So simulation is not about the only technology, but yes, simulation is all about technique. In this setup where we are sitting here without any task trainer, without any mannequin, without anything, we can run a simulation. So that's why we call it as a technique, not as a technology. So we don't want high fidelity mannequins always to run a simulation, but that's a help if we have that mannequins. That's we are creating more realism. We are presenting more fidelity to our students so that they can think themselves they are actually in the actual scenario. Do you all understand? Okay, moving to the next slide. So now coming to the need. So if you see this model, this is a enriched model, this is a modified model. So there are many incidents are happening not in India but globally, which are not reported. बहुत सारी चीजें हम भी करते हैं. We are also going to the patient. बहुत सारे errors हमसे भी होते हैं. गलत मेडिकेशन चली जाती है, पेशेंट को गलत ट्रीटमेंट हो जाता है. So बहुत सारे ऐसे केसेस हैं जो रिपोर्ट ही नहीं होते. If you see the ratio, there are 600 non-reportable incidents, out of which only 30% are coming out. only 30 is reportable incidents. If you talk about if 600 incidents are happening, which are accidents, which are incidents, out of which 30 are coming out, जिसमें सिर्फ 10 होते हैं जो fatal होते हैं, जिसमें सिर्फ 10 होते हैं जिसको हम accidents का नाम देते हैं. So when the reports are not coming, they are incidents. But when the reports are coming out, they become accidents. Because जब बड़ी बात होती है ना तब बाहर आती है. छोटी बातें कोई नोटिस नहीं करता, वो अंदर के अंदर रिजॉल्व होती रहती है. So that's the point. 600 non-reportable incidents, 30 reportable incidents, and 10 accidents, which leads to can be one fatal accident. जब कोई बहुत बड़ी बात होती है, वो 10 accidents में से एक accident जो होता है वो बहुत fatal हो जाता है. So to avoid that, to reduce that, it is very, very important that we should go for this simulation. That only arises the need of simulation. Means whatever the incidents are happening, that should be reduced. If our students are confident in simulation, they can confident on the real patient in the clinical scenario. Right? So can I have the change in slide? So coming to the next, if you see there is a report which says 600 is to 30. Which says if we see that despite of the reasonable knowledge and information, if my healthcare professionals have good knowledge, they are very good at practice, still when the emergencies are happening, they are not confident. I'm very confident in giving chest compressions. I'm very confident in giving ventilations. But when the situation comes to me, I may get panic. Because when some incidents are happening, when some emergencies are happening, in spite of basic knowledge, we are not able to apply many times because we got panic. So that panic environment leads to many accidents. So it is very, very important that put the situations in front of students where they understand before they are dealing the patient actually in the clinical scenario. It's very, very important for every one of us. It's very, very important for every health professionals. Whenever they are going to the clinical area, they should be well versed with what situations come and how situations come. Skills we are learning. Everybody knows we have to give 30 compressions, 2 ventilations. Everybody agrees? 30 compressions, 2 ventilations. Everybody knows. But the point is when to start. What is the promptness? Why to start? How to start? There are lots many things. Patient collapse in front of me. Will I call the responder first? Will I check the response first? Or I'll start immediately with the chest compression. So that panic situations are very, very important to create in front of our students, which is only and only possible in the simulation scenario, which is not like in the real situation, you can't let your students, okay, you learn CPR, but you can do that in the simulated environment. So we are creating that panic environment in our students, that is the replication of the actual events before it actually happens in the clinical area. So it is mentioned, in spite of sound basic knowledge, the healthcare personnel have been found deficient. They know things to do, but sometimes they are not able to perform. So they are in good at performance of skills, problem solving and applications, especially when the unexpected situations, especially in the emergency situations. So that is actually called, that is the need arise from the simulation. Okay, what's next? So in this, I'm describing the process of simulation. So when you talk about simulation, we have already discussed it is not about the technology. It is all about the technique. So when you say technique, that means what? There is a process. So when you say technique, there is a process to run the technique and to go through that. So when you say technique, it has 3 components. One is pre-briefing, the second one is scenario, and the third one is debriefing. So pre-briefing means my students are coming to me. I want to run a simulation scenario on cardiac arrest. Tell them some of the about of the simulation environment. I'll be talking them about my objective. I'll be telling about what are the equipments are lying there, because when you are going to the clinicals, you are not being put in the situation. You have been oriented about the area, isn't it? You are going to the clinical areas, every one of you? Yes. So when you are going into the labor room, you have been oriented about the labor room area. You are going to the ICU, you have been oriented about the ICU. Same thing. When you are calling your students in the simulation environment, you have to orient them about the situation. what I am going to do. But again, what do you want to tell your students and what do you want to keep it? Because actions I will not be telling to my students. I will be telling my objective. I will not be telling 30 compressions dena hai. I will be telling there is a patient with cardiac arrest and you have to manage.
अरे भैया अनम्यूट कर लीजिए,
If
आप
I am
काहे बोल रहे
saying
हैं?
chest compressions dena hai, what will happen? So student is getting the action. I'm not helping my students to think critically. I'm not helping my students to learn and decide with their own learning and knowledge. So I will be saying there is a patient in the ICU and you have to manage the situation. That's all. No need to tell you have to do convulsions. Don't prepare your students. Don't preoccupy them. That is a whole thing. I'm not going to tell the action plans. I'm just going to tell my objective. My objective is there is a patient in the ICU and you have to manage the situation. Then how I have to run the simulation? If I'm telling there is a patient in ICU and you have to start with a chest compression, that means I'm telling to play the role play. That is the difference in the role play and in the simulation. So in simulation, I'm not going to tell any of the action plans. I'm just going to talk on the objectives. What is my aim? Why I have called my students. So that is called pre-briefing. Coming to this scenario. Scenario is what? Now students are actually performing. The patient is on the bed. The patient was talking. Immediately patient collapsed. So now my students will think critically. Once my patient collapsed, what is my first action? I have to check the response. Very good. But before response, are we doing anything else? Before that, are we doing anything else? Why we are calling for help? Because the patient is not responding. But before response checking, what I am going to do? I'm not able to listen. So there is a patient doing some work with electricity and he immediately collapsed. When I go and touch the patient directly, what will I check? So I have to see the safety. So I have to create a safe environment. So first, I will be looking for the scene safety. Then I will be approaching the patient. I will be checking the response. Then I will be for the nurses or something. That is the So what is the scenario here? There is a patient who was talking normally, but immediately patient collapsed. So now my student has to manage. I'm not going to tell my student check the scene safety. I'm not going to tell my student check the response, because if I'm telling these things, what it becomes? It becomes role play. You understand the difference in the role play and the simulation? So that is the scenario. Coming to the debriefing. How many of you can tell me what is debriefing? It is not only in simulation; it is in the daily routine. How many of you can tell me debriefing? This is actually a discussion session. This is not about the feedback. We are not giving the feedback to any of the students when we are running a simulation. Simulation is not about judging somebody. Simulation is not about asking somebody for their actions in a bad manner. Simulation is just asking the students about their action, but in a very psychological, safe manner where students are able to answer. You understand? Where students are able to answer. If I'm saying my student, what made you to go for wrong compressions? Or to be able to answer? No, if I'm asking, okay, I observed you started with the chest compressions. I'm very happy. Would you like to say how it helped and why it made you to start with this way? So she will think and she will reflect back. So that is in the debriefing, we are not telling our actions or the students. We are just talking about their actions, but to know the reason. Just to not give the positive and negative things. We will just talk on the actions, but asking the reason behind it. Why? Every action which my student is performing, I am observing as a facilitator, and then I am asking my students, what made you to do that? Then they will be both happy to answer, and that will become a learning for every one of us. If my student is wrong, then they will learn the right thing. If my student is right, then they'll be able to mention the right and how it helped, and it will be a learning for every one of the persons. You understand? So now if you see the blocks, the first two blocks are of the same size and the last block is a bigger one. So if you talk about the first two blocks, that means it is in relation to the time. So when you say simulation is a 1 hour class. It is not like that. If you are running a simulation, I need more time, because that is a challenge people are facing, and that is a notion people have. Simulation means we need more time. Yes, I do say simulation needs more manpower in some of the situations, in some of the scenarios, but doesn't mean that we are exceeding the time. Students' attention is only for 1 hour. Not only students, even me as a teacher is sitting. If I have to learn more than 45 minutes, even I will be like dancing here and there. 45 minutes ho gaye, ma'am, abhi bhi bhul jaऊं. So that is the tendency you have to understand. So simulation is again for 1 hour. So if you talk about the pre-briefing and scenario, that has the same time. So the duration is 10 to 12 minutes. Depending on your objectives. I want to teach 2 things. I want to teach 1 thing. I want to teach 3 things. Depending on your objective. And if you talk about the debriefing, it has a long block. So debriefing is all about discussion. So the things you learn from the discussion, you can't learn from anywhere else. So that is a more time. So 40 to 45 minutes is the maximum time which we are giving to the debriefing. So not more than 1 hour class, even you are running a simulation scenario. So when you say, can you switch the slide? Pre-briefing and scenario, that makes an experiential learning, and debriefing makes a reflective learning. So everyone is aware about the word experiential and reflective learning these days. So that is the experience. We are putting the situation in front of the students. They are learning about what are the things lying in the labor room. They are learning about what are the things lying in the ICU, because they have to perform. And when they are performing, they are learning by doing. So that makes an experiential learning. You understand? And when you talk about the debriefing means what? Debriefing is reflecting. We are helping the students to reflect on their own actions. Let's take a beautiful example. One day I observed my son and my daughter, they were talking something. I have my 8-year-old boy and 4-year-old daughter. So they were talking among, Krisha, कल ना हम पार्टी पे चलेंगे, मम्मा को बताना मत, पर पहले होमवर्क करें. This is what he told to my daughter. I overheard this. मैंने सुना. My son is telling the word, Krisha, कल हम पार्टी पे चलेंगे, पर अपना होमवर्क कर लेना. मम्मा को मत बताना. होमवर्क करोगे तो ही मम्मा भेजेगी. तो मैंने ये सुना. I called my son. I asked him, what were you saying to Krisha yesterday? He said, Mama, nothing. मैंने तो कुछ नहीं कहा. But आपने कुछ कहा? मम्मा नहीं, मैंने कुछ नहीं कहा. मैंने सुना कुछ ऐसा. हाँ, मैंने उसको बोला था होमवर्क कर लेना. But he is missing some word is party. He is missing that word party because he knows Mama is getting annoyed on this word because I'm telling something wrong maybe to my sister. So if I'm asking my son, I heard yesterday you were telling Krisha, कल हम party पे चलेंगे, आप homework कर लेना. So then he is not able to escape out. He will be able to reflect on his own words. He'll be able to reflect on his own actions. So if I'm asking, कल आप क्या कह रहे थे? He's not able to recall. Maybe he's escaping. But if I'm asking in the same words he was telling to my daughter, then he's not able to escape out of it. But मैंने उसको ये नहीं बोला कि आपने इसको ये बोला कि पार्टी पे चले. आपने गलत बोला. मैंने सिर्फ उसको ये रियलाइज कराया कि कल आप कृषा को कुछ पार्टी की बात कर रहे थे. But I did not scolded him. I did not say something wrong to him. Then he was able to express. So that is called debriefing. You are helping your student to express or reflect back on their own actions, whether it is a right action or whether it is a wrong action, but in a psychological safe environment, in a psychological safe manner. It's not like that we are there to pull the legs of the students. We are there to learn the things. We want to know their frame of mind. We are not there to just give them the feedback. This is right, this is wrong. This is right, this is wrong. We are there to understand their frame of mind. You know the reference, what was the reason they were performing or they were doing this action, so that they learn themselves without teacher's judgment. Do you agree? So that makes a reflective learning. So can you have the next slide, sir? So coming to the debriefing. So pre-briefing, everybody is aware about pre-briefing? So pre-briefing, we are giving the objectives, we are orienting about the environment. So now scenario has already been done. Patient collapsed in front of the student and then they are running the scenario. They are themselves in the situation. They are immersed in the role. So now they have done debriefing. So why I have taken debriefing as a separate slide? Because debriefing is the heart and soul of simulation. Without debriefing, we can't say this is simulation. You have run the pre-briefing, you have run the scenario, but if you have not done simulation, that is the wrong technique. That is not making a simulation. That is the wrong technique. Very important to know, understand the frame of mind of the students that what is debriefing. So when you say debriefing is the performance of the students along with their frame of mind, their thought process. That makes a reflective learning. So until unless you are able to observe their actions, you are able to hear their words, you are able to understand the situation, you will not understand what was their thought of mind. So let's take another example. There are two students, student A and student B. They are in the patient's ward, that is a medical ward, general medical ward. The patients are down with fever. There are two patients. Patient A is down with fever. Patient B is down with fever. So what will be your nursing action? Any one student, please raise your hand and tell me. Cold sponging. Right? There's one student who is talking about cold sponging. Any other action we can take here? That is done. We check the vital signs. We get to know the patient is down with fever. Your action after that. One person is talking for the cold sponging. What about the other student? Any one student. One is cold sponging. Other one is comfortable position. So giving a comfortable position in fever, will it help? Then what will we do? Talking about medication, yes. Will we give medication? Which medications we are giving for the patient fever? Antibiotics. So there are two students. There are two patients. One student with A, he is giving the cold sponging. One student with B, she is giving the antibiotics. So what I am understanding as a nurse, my student A is very intelligent because he is more into nursing actions. Because what I want my student to perform, not the doctor's order. I want my student to understand their decision making and understand that start with the cold sponging and then move to the doctor's order. We are not saying that we are not there to follow the doctors. We are there to follow the doctors, but first we have to think critically and we have to act. So what? My notion as a teacher, very good. Student A, that you perform the nursing action. But when I'm going and debriefing that student, you know what answer I'm getting? Maybe he's not aware. What answer he gave to me? Ma'am, actually, I don't know why we are giving. Okay, I'm asking the question. Student A, I observed you were giving cold sponging to the patient. Would you like to say or would you like to tell what made you to do this action? I'm not saying good or bad. I'm just asking. मैंने आपको देखा आप पेशेंट को cold sponging दे रहे थे. आप मुझे बताना चाहोगे cold sponging आपकी कैसे help कर रही है? So you know what answer I got from student A? He said, "Ma'am, actually I don't know. I have seen my senior sister. That's why I have given the cold sponging." So what is your notion now? Means that student is not intelligent and that student doesn't know the action or the rationale behind, but he is just following what he has seen. So that knowledge is not with the student, but he is just performing the action. So being a teacher, I should not be judgmental. I should be asking the question. I should be debriefing my students so that I can understand their thought process. So now thought process is what? He doesn't know the rationale behind the cold sponging. Coming to student B, I asked my student B, I observed you were giving antibiotics, but I was little upset because jumping to the medication directly can lead to other problems. Would you like to say something? So now you know what my student B is answering. Ma'am, I am aware that giving cold sponging will reduce the fever with many of the principles, but doctor has told me this patient has to go for surgery. That's why I switched to the antibiotic. So being a teacher, I get to know the answer from both the students. So first I was thinking student A is intelligent student. Now my question has been changed because I get to know their so my student B knows the rationale of cold sponging, but there is some reason she performed She went for the doctor's visit. Do you all agree? That is called debriefing. Do you understand the difference of debriefing without saying very good and very bad? Just ask. I observed, I saw, I noticed, and ask why every time. Asking why will help you to know. So now, sitting in the group as a debriefing on the debriefing chair and table, it's not only one student knows the reason of cold sponging. Now all 8, 10, 12 students knows the reason of cold sponging. So that is called reflective learning. So experiences, they are giving cold sponging. Experiences, they are giving antibiotics. But now reflection helps them to understand the rationale. So knowing the rationale is very, very important. Do you all agree? Okay. Moving to the next slide. So Gibbs reflective cycle. So Gibbs reflective cycle is based on the debriefing. So I will not take much time on this actually. So because I've already described on this. So when you say the description, so description is what is there in the PPT. So can you please have the slide here? So what has happened? Description is I observe what has happened. Coming to the next, that is feelings. What were you thinking when you were giving the cold sponging? I was not thinking anything. I was just giving the cold sponging because my senior sister has given the cold sponging to the patient. Moving to the next is evaluation. What was good and bad about your experience? We are asking the student. So how did you feel when you were giving the cold sponging to the patient? We are asking their experience. Coming to the analysis, now we are understanding what else you could have done. Other than cold sponging, what you could have done. So I am asking my students that is analysis part. And then conclusion, what else could you have done? So that is the other things we have to understand from the student. And last, what will be your next action? So now if my students are clear that cold sponging is important, now every student will understand. Next time when they meet the patient or when they see the patient who is down to fever, they will give the cold sponging instead of the agree? So next. So why do debrief again? So debriefing is not about good things or bad things. Debriefing is we are learning from good and we are learning from the mistakes. So good thing, what good thing has happened? Cold sponging. But we are learning why. What was the mistake? Medication. But we are learning why. So it is not about only good actions will be discussed. It is all about the wrong actions also have to be discussed. So we are learning from the good things and we are learning from the bad things. So we are maintaining the corner. So we are talking about especially good performances. No. We are talking about especially wrong performances. No. I have to stick to my objective. My objective is talking on the fever. I am not talking on the good actions. Other than fever they have managed, I am not going to talk about the bad actions. Other than fever they have. So next slide. So again, there is some picture I would like to talk about the results. So there is a patient with COPD. So what happens if a patient with COPD comes to you? What will you do as a nurse? Provide comfortable patient. Very good. What else?
Nebulize.
Nebulize. What else? Oxygenation. So there are 3 actions. Patient with COPD, I will be giving comfortable position. I will be giving nebulizing the patient. I will be giving oxygenation. So what do you mean by oxygenation in COPD? Oxygenation in COPD. Any one of you? How much oxygenation we are giving? When the patient comes to you, how much oxygenation we are giving in COPD patients? 4 to 5 liters per hour. So very good. So when the patient comes to me with the COPD, I observe the patient receives oxygen. What I am observing? पेशेंट मेरा ऑक्सीजन पे है फिर भी मेरा पेशेंट डिटीरियोरेट हो रहा है एक्शन क्या था ऑक्सीजन दिया बट स्टिल रिजल्ट क्या है पेशेंट इज नॉट इंप्रूव्ड दैट इज माय ऑब्जर्व्ड रिएक्शन व्हेन आई एम आस्किंग I observed you have given the oxygenation to the patient. My students are also observing, ma'am, patient को हमने ऑक्सीजन दिया फिर भी पेशेंट की ऑक्सीजनेशन लेवल इंक्रीज नहीं हो रहा फिर भी पेशेंट डिटीरियोरेट हो रहे हैं. So I'm asking a particular student, you know what answer I get in the phrase when I'm asking the frame of mind of the student. I
I understood that there is a knowledge of giving oxygenation is this. Because whenever a patient comes to me in breathing difficulty, I am starting with the oxygenation without understanding whether this patient is COPD or whether this patient is with the pneumonia. Because there is a changes or the differences in COPD and pneumonia. Patient comes to me in breathing difficulty, I can give 10 to 12 liters of oxygenation. But my patient is with COPD, I cannot give more than 10 liters of oxygenation per hour or per minute. So that is very, very important to know the frame of mind of the student without giving judgment, without knowing the things. So now when I am doing the debriefing, that will help me to understand the true gap. True gap is always oxygenation. So when patient comes to you in a breathing difficulty, doesn't mean always start with the oxygenation. Always first thing is to understand what is the situation, whether it is a COPD or whether it is a pneumonia or general breathing difficulty. So that is very, very important. So that's the way the debriefing changes the later actions and the debriefing coming up with new actions and new frames next time. So now when my students are going to manage a patient with breathing difficulty, they will first know what is the diagnosis, or they will start with the less number of or less amount of oxygenation. Next. So that is the debriefing. So now who can conduct simulation? Who can conduct simulation? Yes? Expert. Who do you think are experts? Who can be the expert? Experienced person in which situation? Okay, so I'm not a person who has ever managed a patient with COPD in a real situation. I'm not able to start with the simulation here. Yes, you have a valid point. It is always good if the person is from the clinical area. Always we say. So simulation expert doesn't mean something like a common. It is like we as a nurse, we as a teacher, we when we will become teachers, anybody. But there are some criteria you have to understand. So when you talk about who can conduct simulation, the person should be understanding this picture first. There is a one side, there is an instructor. On the other side, there is a facilitator. So can somebody tell me the difference of instructor and facilitator? Any one of you. Difference of instructor and the facilitator. Yes, please. Very good. Wonderful. Instructor only instruct, only guides. And facilitator provides, helps to understand, helps to learn. You want your teachers to be instructors or facilitators? Instructors? You want your teachers to be instructors or facilitators? Facilitators. So facilitator is very, very important to understand that what is the role of a facilitator and the role of instructor. Do you really think it is always good for a teacher to be the facilitator? वो फिर पता है क्या होने हमारे सिर पे बैठ गया ऐसे हो जाएगा कि बच्चे अब हमें सिखा रहे हैं. It's okay, that's good because there is lots of things to learn from the younger generation, from the new generations. But I must say the teacher has the understanding to know the importance of facilitator and when there is a need of instructor. So teacher is playing a role of instructor as well as a facilitator. So that teacher should understand that when or how to adjust the level of teaching. So sometimes he is instructor and sometimes he is a facilitator. So it is both roles a teacher should have because always students are not able to do the things. It is always sometimes they need some instructions so that they can be guided in a productive manner. So next is in this who can conduct simulation, the person who is a content resource. Can I have the okay? So the person who is a content resource. Content resource means very wonderful point given by that student. That person should be well versed with what is COPD. Then only I can teach COPD. If I don't know what is COPD, I cannot teach. If I don't know what is CPR, I cannot teach. So content resource, that knowledge is very, very important to run any simulation. So simulation is not about technique of simulation. Simulation is teaching some topic through the process of simulation. So that's why understanding about that topic is very, very important. So the person who is able to adjust the level of facilitation already we have discussed, and the person who is able to observe the whole simulation. If I missed something, I'm not able to ask the questions.
So to debrief, to know their frame of mind, it's important for me to observe the whole things. It's important for me to listen the whole things. How they are talking to the patient is very, very important. They are very good in IM injection, but they are very rude in talking. Will you allow that student to go in the clinical area and give the injection to the patient? No. Patient will not allow you, in fact. Teacher allow kar denge, patient nahi allow kar. So important to understand and observe the whole situation, then only you can conduct a simulation debriefing and you can run a simulation. And the next is the person who is good at debriefing. Debriefing is not giving positive or negative. Debriefing is giving the observation, asking the reasons why. So that is very, very important. Okay. Next is, how many of you know about this COP cycle of experiential learning? Raise your hands. Anyone knows about the COP cycle? No one? COP cycle of experiential learning. So this cycle is talking about 4 things. The one is concrete experience. The second one is reflective learning, abstract conceptualization, and active experimentation. This is the same thing which we are talking in simulation. So when we talk about concrete experience, means we are putting the students in some situation. They are learning when they are doing some hands-on. That is a concrete experience. Coming to the reflective learning, now I am asking a question on their actions. That is, I am helping them to reflect back. So when they reflect, they learn more. When they do, they learn. When they reflect, they learn more. And when they do again, they conclude what is right, what is wrong. And then they again actively participating in that situation. So that is called active experimentation. So COP cycle of experiential learning is only talking about this helps in the simulation. Because when you talk about simulation, it's very, very important for our students to get into that experience. And it is very, very important for a teacher to let them reflect back. So that's the way this becomes a experiential and reflective learning. So that students can learn more and then they can move into more experiences and experimentations. So other than this, there is another approach which we talk in the COP cycle that I'll be talking in the next one. So before that, I want to go for the role of a teacher. So when we talk about simulation, what is the role of a teacher? The teacher is focusing what my students are performing, group attention. The teacher is engaging the students by getting the group attention, and by engaging the students, they are building some consensus. That is very, very important thing to understand. And when they are engaging the students, they are gathering the information by observing, they are gathering the information by listening, they are gathering the information by maintaining the balance between the intuition and the actions. So the role of a teacher is basically on the focus, engage and gather. So that when my teacher is attentively observing my students, attentively listening my students, and they are bringing the students on the one page when they are sitting on the debriefing table, it's very, very important to get the knowledge from each and every student so that the students can learn in a whole. It's not about what my teacher is saying is right. It's not about what my student is saying is wrong. So it is, we are building a consensus so that we can focus on the actual parameters, right? So next slide, please. So now we are coming to the point why there is a need of simulation. So why do you think simulation should come across? So there is one study, that is NCSBN's study in the 2015. What they are talking about, that if we are giving the simulation, clinical and any learning to the students, there is equal effectiveness. So that they are saying, if I am not able to give some of the exposures to my students in the simulation, but in the clinical, equal learning will take place. Can I have the thing? So what they are saying, if some of the situations, because it is not possible to take all 100 students to the hospitals, to let every student to go through some critical or complex situations. Some of the situations which is not faced by every student. Thus, there is a patient with hypovolemic shock. Next student, they did not get this opportunity, but that is a possibility in the simulation. So that is what they are saying. If high quality simulation can substitute up to 50% of clinical areas with the traditional learning, which is equally effective. So if my students who are managing a patient of hypovolemic shock in the clinical area and same time of situation I can bring into the simulation, the equal learning will take place. So that's why we should switch to the simulation, because you know these days there's a big size of batch in every college and the patient footfall is not always available, and all these situations is not possible to teach through simulation, through clinical. So we can definitely let the students go through simulation so that they can learn equally and effectively. So next is, there are some evidences which are supporting this. There are some evidences which says simulation should be the next generation, should be through simulation also. So when I am saying simulation, again I am repeating, it is not the replacement of clinical area. Please understand. It is just a help. It is just a fortunate thing which has come that we can give to our students through simulation, that we can deal many situations which students are not able to face in the clinical areas always. So when you say best practices, this is characterized by this. One is facilitated reflective debriefing. So when you are able to let the students reflect, then the learning will take place, right? So they are saying debriefing is equal to reflective discussion. So when they reflect, they learn more. Next is feedback. So when you say about feedback, it is not positive or negative feedback. It is the feedback in a constructive manner. So that is we have to take care of. So feedback, we are just providing the information. We are not scolding the students. We are not being biased. We are not being judged. So next is repetitive practice, LDHF. LDHF is this low dose, high frequency. So if I want to teach newborn resuscitation to my students, I have taught the whole newborn resuscitation today, then I'm calling my students in some slots. Next time I'll be teaching them the compressions only. Next time I'll be teaching them the ventilations only. So low dose, high frequency. So when I'm teaching them the compressions, I'm teaching it multiple times. So do you think it is possible in the clinical area? No, but on the mannequins and simulations, it is possible. So low dose, high frequency is another benefit, that we are improving the competencies with small and frequent learning activities. So that helps the student to learn and retain more. So next is distributed practice. Next is curriculum integration. So distributed practice means we are giving them everyone that they learn in an actual way. So everybody is getting an opportunity to learn, and everybody. So it is not only 10 students are learning about hypovolemia. It is every student is learning about hypovolemia. So next is clinical variation. So it is like some of the unmet situations. I have never seen the patient with anencephaly. I have never seen the patient with newborn resuscitation earlier. So it is like we are helping the student to learn in different variations. Next is range of difficulty. Please move on the slide. So individualized learning, multiple learning strategies, defined outcomes, and many more. So there are lots of evidences which say simulation should be there in the clinical practice. Simulation should be there in the nursing practice or in the health professional practice. So next, why simulation again? Everybody knows this, right? Chinese proverb सबको पता है ना? If I hear it, इधर से सुनेंगे, इधर से निकाल देंगे. ऐसे करते हैं ना सब लोग. इधर से मैम तो बोलते ही रहते हैं. कोई बात नहीं. अनु मैम तो हर बार ही बोलते हैं, इधर से सुनो, इधर से निकालो, कोई बात. So if I hear it, I will forget. If I see, I may remember it. क्योंकि मैंने देखा था. Red color ही था, मैंने देखा था. I'm remembering. Color I do remember, right? Next is if I do, when I'm doing hands-on, I will know why and how. And the last one is if I discover it, I use it. So anybody wants to comment on the last point? यूज भी करते हैं. वेरी गुड. सो आई एम वेरी बैड एट डोसा. मेरे को साउथ इंडियन नहीं बनाना आता. मैं पंजाब से हूँ, मेरे को पराठे बनाने आते हैं. सो आई एम कुकिंग डोसा वन डे फॉर माय किड. उसमें मैंने बहुत सारा देसी घी भी डाल दिया, मैंने सब कुछ डाल दिया, बैंगन भी डाल दिया, जो भी वो नहीं खाते सब कुछ डाल दिया कि आज तो सारा न्यूट्रिशियस खिलाना है बच्चों को. अब क्या वो उनको तो स्वाद नहीं लगा ना, वो दे डिड नॉट लाइक इट. नो, डोसे में बैंगन कौन डालता है? दिस इज द आंसर आई गेट. डोसे में, सांभर में नहीं, डोसे में. So what happened now? I know how much efforts I put in. I know how much time I used in it. I know how much nutrition I have put in it. मुझे पता है इसमें कितना देसी घी लगा. मैं इसको फेंक नहीं सकती, तो मुझे तो खाना ही पड़ेगा.
So this is the same thing happening. So if I discover something, so while I'm going to request everyone sitting here, being a teacher, simulation is not what I am talking about. Simulation is not what you are learning in the simulation center. Simulation is just to understand what is the concept and to discover your own ideas. When you discover your own ways, definitely you will use it. So it is very, very important. Try to learn the things in not a manner that we are there to learn. Try to understand the things. What is simulation? And try to discover your own behavior towards simulation. Try to discover your own gestures towards simulation, because there are millions and zillions of ways of simulation. It's not only what Anu is saying. There are lots of ways. Do you agree? Okay, coming to next, there is a Savi approach. In this approach, there is a who is talk.
बंद हो गया ना? हाँ
छुट्टी ली थी 4-5 दिन का है तो हमको कुछ पता नहीं चलता इंडिया में जब बहनी थी तब जब बहनी थी
क्लास में टीचर नहीं है क्या? जाओ जाओ जाओ
नहीं और ऊपर था सर इधर था मजा आया था
सर ऑफिस में है ना? यार ये बड़ा खराब चीज है।
कृपया शांत रहें।
लिया होगा कितना है
भैया हमने कहा बता रहा है करते हैं शांत रहे, हम तो म्यूट किए भाई।
अभी अगले बजे स्टार्ट हुए। लॉकडाउन में इसी तरह से घूमते थे।
हेलो मैम, खाना खाना चाह रहे हो?
for tea break. So, session. The topic for the section is current trends in simulation, evaluation, and research. So we are extremely happy to have with us our next speaker for the session, Dr. Binu Jo. I'm requesting sir to come upon a stage on the dais, please. And I would like to invite Mr. Santosh SU on the stage as the chairperson of the session. So please come up on stage and occupy your seat on the dais. Thank you, sir. So before we start the session, I would like to introduce our versatile personality, Mr. Santosh SU, chairperson for the session. Sir is nursing professional with an impressive academic background. He completed his PhD in nursing from Sri Venkateshwara University, Amroha. Sir has also hold an MBA in hospital management from Integral University. Sir has completed his MSc in pediatric nursing from Bharati College of Nursing, Karnataka, affiliated with Rajiv Gandhi University of Health Science, Bangalore. Sir's undergraduate degree is a BS Nursing from Sri Kanaka College of Nursing, Kanpur, Karnataka, affiliated with Rajiv Gandhi University of Health Science, Bangalore. With his extensive education and expertise, Dr. Santosh SU has made significant contribution to the field of nursing and healthcare. Sir is a well-rounded nursing professional with expertise in various areas of the nursing field. Sir has actively participated in disaster management program and school health programs, so causing his commitment to the community's health and welfare. He has taken part in World Breastfeeding Week and has organized and participated in many national and international conferences, demonstrating his vast knowledge and expertise in the nursing field. Sir holds a certification in NHCPS PALS code, Pediatric Advanced Life Support. He also served as an external practical examiner from UP State Medical Faculty and Atal Bihari Vajpayee Medical University, Lucknow. He has also worked as an inspector for evaluating nursing colleges in UP under UP Medical Faculty, highlighting the role in improving the quality of nursing education in the state. Sir is also serving as a board member at UP Medical Faculty, Lucknow. He has received a distinguished teacher award from Ganga Shield Group of Hospital and Institution, Bareilly, on the occasion of Teachers' Day 2022. Sir is a reviewer board and editorial board member in many national and international journals. His vast experience and expertise in the nursing field make him a valuable addition to any healthcare organization. We welcome you, sir. So now I request sir to introduce our speaker.
Good afternoon, everyone. I would like to congratulate Dr. Deepti Shukla ma'am for organizing such a wonderful workshop on the simulation in nursing. And I would also like to thanks to the management of SAMARPAN Institute for providing an opportunity to organize the event like this. And simulation in nursing, what the workshop we are organizing here in SAMARPAN Institute, it's like you all know that Uttar Pradesh government is striving to improve the quality of nurses and nursing students all over the UP. In the aim of that same, the institute is trying to provide the knowledge and improve the quality of nurses. For that, they have organized this workshop. And without wasting much of the time, I would like to invite our guest speaker for the next session, Dr. Binu Jo sir. Binu Jo sir is working as a principal in Christ College of Nursing, and he's also a founder member of the Nursing Scholar Society, and is specialized in Master of Science in Child Nursing from Vinayaka Mission University, and he has completed his PhD in nursing from SRK University, Bhopal, and also holds an MBA in hospital administration. And Binu Joseph has completed a diploma course in naturopathy and yoga, and also has received distinction for his research paper presentations. And Binu Joseph has published more than 20 papers in various national and international journals, and has served as a resource person in 9 state level and 13 national level conferences. And he has also presented 5 papers in national level conferences, and is also an editor of 3 national journals and 2 international journals. And he has won the first prize in the scientific poster competition at Vinayaka Mission. And also, Binu Joseph has authored several textbooks, and few of them like Child Health Nursing for GNM students and one Nursing Research and Statistics for BSc Nursing students, as per the revised new curriculum for BSc, and also a cumulative record book he has written for BSc Nursing student, and his impressive credentials make him a valuable contributor to the field of nursing education and research. I would like to invite Binu Joseph for the session.
Respected distinguished dignitaries, expert speakers from various institutions, Dr. Krista ma'am, Dr. Jagdish sir, Naveen sir, Anu ma'am, Mrs. Santosh ma'am, and the director, all my dear budding nightingales, dear nightingales. I'm very privileged to talk in front of you all nurses. It's a great to see you all charming young budding nurses taking forward to the light, to the new caring of the patients, caring to the society. Yes, the current trends in simulations, every field there is a trends. We have to be with the advancements. If we survive with the advancements, we lag behind. We have to continuously learn. Learning is lifelong. As a child from the womb to tomb, learning is lifelong. Learning cannot be stopped. As you stop learning, means you have developed an attitude. Develop it positive. Learning should be always positive. So every industry strives with new trends. So you have to come with new innovations. Otherwise, every teaching and every creativity of things will go fair. So if you want to shine, if you want to be bright as always, so you have to go on continuously improve in yourself. So there's always trends and simulations. So we have to accept, yes, it's like we have to create a real situations. Like we tell every child is precious. As a child is born, it gives a sense of uniqueness, love. Everyone is happy. Oh, this child is very beautiful. I want to hold. All are coming to hold a new child. But we are compromising many health issues while holding a child. We have to be very meticulously and very carefully plan that. So there is basic some trends in current trends in nursing education, specifically in the simulation industry, which I will try to come forward with you. Yes, we have to accept that virtual reality is very posted a significant challenges in nursing education and also in the simulation industry. In COVID-19 pandemic, yes, we had to continue education as learning is lifelong. You cannot stop an education. Something happens, stop. No, we have to overcome that. So virtual world has made things, everything a reality. Simulation has got a very positive impact in teaching learning. Yeah, it is a day by day increasing field knowledge. It is trying to enhance new methods of teaching. It has very much incorporated in various clinical areas. It has empowered in clinical teams, improvement in the surgical skills in the field of ophthalmology, specific health techniques, critical care practices, dissertation practices, medical emergency, neurosurgery, anesthesia, and nursing education. Simulation has played a very tremendous role. Yes, as much as we can keep the real world, if you keep the situation as real as possible, the use of standardized things and use of any real simulations, as Madam was saying, that high fidelity, you have to create as much as real simulations to the possible. So in simulation also we have to create as real as the patient is, which we are going to face in a hospital setup or a clinical setup. The standardized patients, which is very common in simulation, has got a very positive impact on interprofessional education. The interprofessional simulation has a very good perception, according to some reports, regarding the impact of simulations about the quality care of the patients. Interprofessional collaboration, interprofessional education. See, we should not only think the simulation in nursing. We should try. It's always best to learn from seniors, juniors, everyone. Learning is lifelong. So everywhere get the knowledge. मूवी देखिए ना 3 Idiots. बेवकूफ बन जाओ, घरे बन जाओ. अगर सीखना है तो घरे बन जाओ. Empty, become empty. Empty your cup. If your cup is filled, you cannot gain knowledge. Whenever you want to gain knowledge, please empty your cup. Please empty your bottle. Please empty your knowledge and learn. कहीं से भी कुछ भी सिखा सकता है. छोटा बच्चा रोके भी कुछ सिखा सकता है. So anyone can make us learn. So learning is lifelong. So we should accept the translational research studies. The research studies in the simulation field, in physiotherapy, what is happening, in the medical field, in the pharmacy field, all the studies in the simulation industry needs to incorporate those, and we need to take a step forward in the better how we can keep best in the simulation in nursing education. Next, please. Healthcare education is rapidly changing with the use of ever-increasing use of technology. We have to come out from this traditional one-to-one teaching or a classroom teaching. We have to come students. We cannot. Students are very creative. Students are very innovative. Every person is unique. Everyone is unique. Everyone is having some talents. So each child needs some creativity and innovations. Only if you keep only one method of teaching, always the interest, the motivation, the learner motivation and interest will not be that high amount. So to attack the motivation of the learner, we have to always have a new aspects of teaching. So simulation-based learning in medical education has evolved from the years. It has firmly established as a critical pillar of the nursing education. So we have to accept it is going to be one of the basic foundation to enhance our quality patient care to the patient. There are basically, there are basic 6 trends or basic 6 trends which are happening in the simulation in nursing education. Next slide please. Hybrid learning. Yes, we have to accept, we cannot be stick to this classroom teaching. We cannot accept that we will always be in a classroom teaching. We have to incorporate various technological advances for the betterment of the industry. So you cannot keep education to one sector or education to one area. Like conference is happening in this forwards. You cannot keep knowledge here. Knowledge is to spread. A rose also when it gives essence to other. If your knowledge essence reaches to everyone, then only is that use of that knowledge. Developing a good simulation center, but it does not give the knowledge that will be not worth. Like a good simulation center has been created in SGT University under the great leadership of great personalities which we have listened to her, Ma'am Anu Grover, ma'am. How beautifully. So the essence of knowledge only spreads when you impact and give. You cannot keep to one area. You have to use that use of technology. This classroom teaching is being live and it is going to different places through the Zoom platforms. In YouTube platforms, the people are watching. So you should make and incorporate various sources how to bring out this teaching from one area to another area. Hybrid learning should always be incorporated in every industry. Next, the fact of the matter is that student expectations varies. Every student is unique. Everyone is having capacities different. Everyone's IQ is different. See, everyone's IQ is different. A good educational institutions, I tell you, which are the premium institutes across India? Yes, said Mary's, very good. Okay. Yeah, all agree. Everyone is premium. So there's no need to worry about. You should feel courage, the strong determination. Yes, said Mary's. Yes, Samarpan, we are doing here. Yes, everyone. It's every university is near. Some say that the best premium institutes are AIMS. I don't tell it's AIMS. Because they take best and they produce best. We take worst. If we produce a little good also, it's good. Which institutes they are taking the best and producing the best, what they are doing? The institute, it takes the worst because we have to teach everyone. Everyone is unique and we not get all intelligent students. As a teacher, if I become teacher, if a failed student is passed or if a failed student reaches to the 60%, I will feel happily from that. I don't want to make a brilliant student because he's a brilliant, he just needs to be guided. He needs just a mentor, he needs a guider, or he just needs a fascinator. But we have to impact teaching to everyone. Everyone's attention needs to be kids. It's not that only a brilliant student should come out. There are very shy students. There are very weak students among us. They also the teaching should reach. So the students are very in their capacity. So we should also think of how the teaching can be incorporated by various methods of teaching, how teaching can conveniently reach to them and they understand. Yes, in a survey conducted by educators, 75% of educational institutions have now adopted this. Previously, before COVID pandemic, we were afraid, oh, what will be the Zoom? How to teach? No, not I will not teach. A classroom teaching is the best teaching. Now, I think we are trying to, we have accepted it's a virtual reality. We have to accept hybrid mode of teaching. We have to do a blended teaching. We have to incorporate the classroom teaching with technological devices, with other new technology. We have to use the platforms, Google Meets. We have to use the platforms of Microsoft Teams. We cannot only depend on one platform. Every platform has its own benefit. Every institute has its own identity. Everyone is unique. The second trend which is happening in the simulation industry is analytical and advanced competency tracking. There are various technological softwares available. You can use these softwares. We can use this software just after a simulation training has been taken place. A simulation training has been given by an instructor. Is given now through the competency tracking software systems. We can come to know how much the competency skill the student has achieved. Whether the student has achieved 100% competency skill in that training. Whether some students may attain 80%, some may attain 60%, some may attain 40%. So these tracking softwares help us to know where the students are standing at particular time or particular training point. So we can easily make remodification. This tracking softwares helps to remodify, helps to re-demonstrate so that the 40-60% can come up and competency skill in the caring of the patient improves. Advanced analytical competency training softwares interviews the existing simulation platform with robust tracking systems and reports the solution with access to multiple layers of activity-driven simulation data and indicators are utilized provide analytics, comprehensively track competency-based training activities with various studies. The automated systems can quickly identify where the pitfall is and set appropriate notification for the intervention of students and faculty to prevent learners from falling behind in simulation-based learning methods. So these softwares can help us where we are gapping, where we have pitfalls, how to improve the competency skills of the student learners. Next, third is third trend is expediting practitioners in the healthcare field. Yes, we should accept some that we are always shortage of healthcare workers. The statistics always government puts up every now and then statistic, this much healthcare staffs are lacking, this much staff nurses are needed, this much healthcare workers are needed. So when we need a large number of healthcare workers to care our own patients, to care the humankind or the society as a whole, we have to expedite we have to make them train fast. So we cannot depend on, we have to be creating a simulating centers. So the simulation centers can expedite the healthcare practice. It's very difficult to get all types of patients. Every patient we cannot get, like I was telling, you cannot go and ask, I have to give GP. Patients get irritated, patients needs privacy. And in an hospital, many of the hospitals are attached with the government setup of hospitals, where around 6 to 8 colleges comes bombarded there. And exams are also conducted same time, same. I have seen some colleges where the same patient has been given, morning exam is going on, afternoon is also going on, evening is also. So what happens? Same patient you tell about history. Patient is so much fed up, he needs privacy, he needs an emotions, he needs a peace, he has come for a rest. If every time you go and communicate, they feel. So we have to create the simulating centers with a high fidelity or high realism. So exactly the replica of an hospital is created where you can practice, where you can train, and then you can clinically care the patient outcomes in the clinical real world settings. Yes, this study was also quoted by Madam. She has told, yes, we got National Board of Secondary Education has found that 50% of the traditional nursing hours can be replaced with simulations. Madam has also pointed out in her studies. So this study, you can replace the simulation industry, can replace that much clinical hour, that much patient training. Next. Now the fourth trend, which is happening in the simulation industry, is further integrating ongoing health education in the healthcare environment. Yes, I am told learning is lifelong. You cannot stop education. You become graduate. Oh, I become postgraduate. I become doctorate. I become postdoctoral. I have done this much patent. I have done this much thing. No, we have to continuously. We have come for a mission. We should have our own mission and vision. When you have a vision and mission, then the reality. So you have to always lifelong. We are in a working sector where with the service to mankind or service to mankind is next compared to a divine. If you are caring of the patient, you are taking care of your divine. Humankind, helping the patient is, you should think as a divine. A lady with a lamb, with only a few battalions, she was going there in a Crimean war and taking care. So here also we have to learn lifelong, and at the same time we have to live for that. So if you want to sharpen, if you want to be sharper, you have to be always competitive. Yes. Yesterday only I attended an interview. So in an interview I can see there's so many faculties have come for that interview. So much depth of competencies. So who is having sharp flame? They conduct notification is issued. Then many people applied for a post. And they did why? They want all the healthcare industry, they want a good person, a best person is taken out. That is their mission and mission. So same way we have to be in a competitive world. If you don't continue education, no, I have attained everything, I have become this, I have become this, I am in this post, I am satisfied, I am getting good salary, everything is good. I have good institute, have a good institute, everything is good. We have an AC auditorium, we have everything, we are comfortably sitting. We had a good tea and a very good, everything was good. But yes, this thing becomes empty if you don't learn. Learning is lifelong. So any industry, any simulative industry also, anything, we have to become updated. Latest technological advances always comes. It is no stoppage to anything. It is lifelong. The cells will lifelong, the education will go on. So always we have to incorporate, we should be abreast with the latest technological advances happening in the field, and we should try to always gain the knowledge. Okay, next please. Next trend which is happening in the simulation industry is in situ simulation, real life situation. Create a situation which is exactly the same in the hospital. So how nicely madam is showing a PPT in the environment. Same was like an ICU. It was same like an intensive care unit. There was a privacy was there. Sterile articles was there. Everything, you created an environment similar to that. How much real situation you create, that much the student has the understanding the gravity of the situation. This much seriousness of the issue. So that much real situations will make them understand, yes, they feel proud, yes, I am going to learn something new. That situation needs to be created, that seriousness needs to be created. Yes, this is a simulative centers, but you are going to care for a patient. You are going to care for a patient where you will be responsible, where you will be accountable. So simulative centers, we create a real life situation so that maximum learning, 100% learning of the same like of a real situation is. Because of in-situ simulation, implementation, actual clinical environments, educators can provide learners the ability to improve their clinical reliability and safety high-risk areas without any danger. The unique on-the-go style medical simulation focuses on teamwork and provides high amount of realism, which can be accomplished by standard simulation standards. Everywhere this cannot be. You have to maintain a very good quality, and it should be a very standard simulation centers which are following all the standards of the organization bodies, which to be laid down to be maintaining a simulative center. There are criteria to be maintaining to be a simulation centers. So why we are doing this? After all, our ultimate aim is to reduce patient injury. We should make our patients safe. They should feel that they are very injury prone. They are not. In a simulative center, if you cause any harm to the simulated patients, oh, nothing problem. Yes, you are learning. So while you learn, you create mistakes, right? So we have to create mistakes in a simulation center, that is best. Why? If you create real life situation or a real clinical settings, then we are really responsible and accountable to the patient. So it's best to learn, practice, do, and everything in a simulative setting. The next trend which is happening in the simulation industry is telehealth simulations. We have to use knowledge. Like we cannot expect every time Anugrova ma'am coming from Gurugram to here. Yes. Every time she has other commitments, other responsibility. Every week they train the students, right? But through the telehealth, madam sitting in a small department, you can incorporate the technology, the available technological device, you can get it. Nowadays, WhatsApp video sharings are there. There are YouTube videos. So through this, you can approach them. If you need to drink a glass of water, you have to ask, can I get water? If a small nursery students, they are trained. In a small nursery students, they train? They don't train a big things. They only train nursery students. They train what? May I go to washroom, madam? They train this only. They want that only. Why? They should learn that discipline from the starting. How to go in a life. Because what happens in a house when a child is there, he does not ask to the washroom, go to the washroom. He never asks mommy. Any child, I'm just telling an example of a 2-year-old a child or a 3-year-old child, he never tells. He may pass in the bed, he may pass in the, you are sleeping, I am sleeping, my child is there, you see I am in a water bed. Oh good, oh, water is there, rainy is there. But the child may have urinated. So like that situations may come because he is not known to that. And we are also not forced. But when the child goes to the school, the small nursery teacher, with dedication, with patience, she teaches. She teaches them go in line. The students will be like this going. Now we will be going. Just we went outside. How we went. So a nursery student, we should visit, all people should visit a nursery student, how they handle, how beautifully they handle. And they ask, may I go to washroom? And in house they don't have. But this discipline, this learning, that makes telehealth simulations, that helps to create an environment. We should get learning from anywhere, any situations. Everyone is unique, everyone is. So we get the knowledge maximum from various sources, incorporate this telehealth in teaching, get to use. Some teachers will be there who is teaching sitting in America. Many of our nurses have gone to Americas. I'm basically from a Kerala background family where 80% of my family is also in Kerala, is outside India. All my Kerala nurses are outside India only. They don't want to work here. Majority of the nurses, Kerala nurses, gone abroad, America, USA, everywhere are there. They want to go everywhere. Why? Yes, they have to go. They have their own responsibilities, they have their own commitments, and they go. But we can make them, use them. A nurse who's sitting in America is in a big post of some unit. You can just call her, ma'am. Can you ready to come and talk to us? They will ready with these simulations. Use this. Technological advances needs to be taught, and from there, they're sitting in America, they can teach us. So telehealth simulation is another industry which has helped in simulation training. The arrival of COVID-19 pandemic has clearly highlighted the need of COVID healthcare service delivery, telehealth, but impactful training for telemedicine encounters has was nearly non-existent. Since the pandemic, telehealth has taken a dominant role of simulation-based learning in medical education and nursing education. Healthcare educational institutions have quickly noted the importance of telemedicine. Ready simulation management platforms are there. They have helped them modernize the training programs to merge, manage virtual, online, live, mobile training. So we can use resources. There are various video-based teachings available. There are various simulation-based trainings, videos available. It's how we use them, how we use the benefits of this. So these are the basic 6 trends which takes place in the simulation industry. The first trend in simulation nursing education is the hybrid learning. Use of technological advances, hybrid learning. Then second is continuously learning, adult learning education. Third is the use of analytical softwares to know various core competency skills, where we are lacking. And the fourth is in life situations. The real life situation, create a real life situation by the simulation industry. And then we have the one more, that is telehealth simulations. So these are all the basic trends which are taking place in the simulated industry. And there is one more trend, that is we have to expedite, because of depth of shortage of staffs and healthcare practitioners, we have to expedite the resources by get them trained in the simulation healthcare centers, and they go and teach the students in their own centers. That is what the SGT center did. They call the teachers basically, and INC also promotes, and the teachers go and train. Now the teachers has responsibility and accountability. They should come and teach back. When what happens? Learning is what? Learning is when you give. Learning is not you give it yourself. You have come here to give. We all have come empty-handed. You are going to be empty-handed. So what you have gained, you have to give. That is your responsibility, and you are accountable. You cannot say I am a well intelligent, I am a first class, I am a gold medal. Your gold medal is only used when it is given back. You have to give that gold medal. What you have earned, you have to give back to the society. Because we all have come empty-handed, and we are going to be empty-handed. So that is a reality. So in this life, we have to accept it. So knowledge should be shared maximum so that it reaches to the every corners of the world. Now I will try to add up one more these things, that is everything we think, even if this mic, if mostly mic, if you purchase it at 20,000, whatever the rate, if you purchase it and it does not give a return on investment, आज कुछ भी चीज खरीदते हो, एक एप्पल भी खरीदते हो तो कुछ ये अब तुमको फायदा करेगा, खराब है कि अच्छा है. एक small pen also we buy, we think how much days it will use, how quality it will be. So we are always thinking return on investment. If you come and attend a conference, you think क्या फायदा होगा या नहीं, 10 questions पूछ लेते हो, कैसे खाना देंगे वो लोग या नहीं, नाश्ता कैसा देंगे, all type of questions. We are in a world of return on investment. So if we establish the simulation centers with so much expense, whether we start thinking on return on investment, we start to evaluate that things. Yes, evaluation is needed, and this is one of the simulation we can evaluate. That is a tool. It's a standardized tool, debriefing assessment for simulation in healthcare. Debriefing assessment for simulation in healthcare is a standardized tool. It's a 7-point rating scale where we evaluate the performance of the trainer, simulator trainer, how well, and the team who has been training, how well the performance of the training was, how effective it was. In a 7-point rating scale, we evaluate. We give a score of 1 if it is extremely ineffective, and if we give a score of 2 if it is consistently ineffective or very poor. If we give a score of 3, then it is known as mostly ineffective, means 80 to 90% of the program was not effective. Consistently effective means no, if this training was not at all effective, means 100% that was not effective, and we give a score of 1. 90% roughly, I'm telling 90% it is not effective and consistently ineffective, we give a score of 2. And mostly ineffective, you think no, at least some point only 60 to 80% was ineffective, then we give a grading of poor or a 3 score. If we tell somewhat effective, yes, this simulation training was somewhat effective, then we give a score of 4. Or if we compare it as an average 50%, the program was successful, कुछ समझ में आया, ठीक-ठाक था, it was good. Yeah, again, some knowledge was there. 5th, if we give a score of 5, then it is not as mostly effective, we grade it as a good. Yes, 60 to 70% it was good, it was a worth to go and attend there. Consistently effective, very good. Yes, 80 and 90% above the program was effective, the simulation training was very effective. And 7, we give a score of 7 when it is very extremely effective or a very outstanding. So in a 7-point rating scale, the standardized debriefing assessment simulation for healthcare tries to evaluate the performance. Because we are in a world of return on investment. We want everything to be, we build a auditorium, how much purpose we are building it. If we purchase this projector, how much useful it will be. If we start a unit of dialysis unit, hospital in a we have a super specialty hospital. So if we start a unit, our management and all will start thinking, if I spend this much, how much return on investment? So same way in simulation industry, DASH is a standardized rating scale where we try to evaluate the performance of the simulation training. DASH is used to assess the instructor behavior, how well an instructor sets up an environment to facilitate learning training with the help of simulation. In DASH, this debriefing assessment simulation scale is a 7-point rating scale where there is an element 1 and element 6 elements are there. Total 6 elements are there. First element is basically related to the setting up of the simulation, how well the simulation is there, how well the conference is planned, like just creating an environment, how well the conference is planned, what about the location, what about the temperature, what about the seating capacity, what about the uses of gadgets available, what all technological sources will be enhanced. So what are the locations? So that is one thing, that element we track through the debriefing. And what is the exact, establish a place for learning environment, maintaining and engaging a learning environment. Now the environment is created, a place has been fixed for the simulation. Now how much learning takes place, how much effective learning is taking place. That is also how much how much simulation training taking place in that area. Structures debriefing in a very organized way. Everything should go in a very sequence and a very logistical way. You cannot mix up the point 1, then directly go to the point 6, point 7. Jumping from point to point when it create a lot of hazards. Everything should be in a very sequence and a very logical way. Then only the things can happen. So structures debriefing the program of simulation training in a very organized way. Provokes engaging discussions. See, when you are in a simulation center, always a simulator or a trainer should be more like a facilitator. You have to switch the job. When to become in a systematic way, when to become a facilitator. Because sometimes what happens, students may think that now questions will come to me. See, without thinking my questions, they come to me. So some may be humiliated, some may feel. Directly questions should not be. Environment needs to be created. And then they think it's like a discussion phase. So when a discussion phase is there, all are starts talking, a shy or a humiliated student who is a very weak student, he will also start talking. He or she starts talking. That environment, because a well-trained, like we were seeing the previous section was going on, a volunteer was trying to arrange the tables front, and a question was put up. The volunteer was very eager to answer the question. Because that shows he is well active. He was well active. But in this, and we have to engage discussions to the last benchers, the back benchers, the shy students, those who feel that the question should not come. Like some questions asked, me like will go down only. I have kept my head down only. The next question should not come to me. So encourage a discussion in a simulation training center. If a group is less also, all should become active. The simulator, trainer or a facilitator should provoke engaging discussions, create an environment, identify and explore the performance gap. We have to find out. Before pointing others, try to imagine 3 fingers are pointing us. Before pointing someone, you always imagine 3 fingers are pointing to us. Only 2 fingers is pointing to us. 3 bullets are under me. Before shooting you, 3 bullets will come here also you shoot. So that is what. So explore the performance gap. What was the gap in the performance? Exploring that is must. We have to explore what was the pitfalls, where we were lacking, where the teaching was not that much effective. That is very much important. And help to attain. If you find out the performance gap, then we can improve our performance. That is the element 6. We can improve our teaching, we can improve our re-demonstrations, and we can correct them. So the performance. So these are the 6 tracking elements which we assess through this simulation scale. It's a standardized rating scale, 7-point rating scale to assess how effective the simulation training given by the instructor or the team. So this is just, I will try to make it little fast. Each element also needs to be rated. There are 6 elements. Each element needs to be given a score of 1 to 7. And each dimensions of that element also needs to be given a score of 1 to 7. So you think, your only element needs to be. So element first is establishing a place for learning environment. Now you have to think whether the environment was good, the chairs were comfortable, people's concentration was that much, whether it was too much boring or what was the thing. So every good environment was created. You rate them 1 to 7. If you have rated 1, it means that it was not ineffective. If we have rated 1. If you are rating this was extremely good or excellent, outstanding, then you are giving a rating scale to 7, which is the highest. So element needs to be rated. So the element 1, and in element 1 there are various dimensions of the element 1. Yes. So in element 1, the various dimensions which we rate are introducing itself, describe the simulation environment, what would be expected during the activity, and introduce the learning objects, and clarifies the issues of confidentiality, explains the strengths and weaknesses of the simulation, and what the participants would get most of the simulated clinical experience, attends all the logical details such as place, food availability, schedule, washroom facilities. Simulated participants share their thoughts, the questions about the upcoming simulations, and debriefing. He assured them that they would not be shamed or humiliated in the process. So each dimensions of that element also needs to be rated in a grading of 1 to 7. Okay. Next slide, please. So next element was maintains and engage in a learning environment. Here also you have to rate this element, how effective was in a grading of 1 to 7. The various dimensions which we rate in this element is clarifies the purpose of briefing, what was expected of the participant, role of instructor, and the debriefing, acknowledges the various concerns about realism and help the participants to learn even to the case where simulated. Showed respect towards the participants and sure the focus was on learning and not on making people feel bad about making any mistakes. Empowered participants to share notes without fear of being shamed or humiliated. Mistakes only, they only learn. If you don't make mistakes, I will try that. You are a zero that you always win the race and you are failures are the cornerstone of the success. Always try to become a hero, then of course you will be a hero. So always try to become zero, you will be always zero. So when you those who have failed, those who have committed more and more mistakes, they learn. Through our mistakes only we learn. So we have to create these dimensions. Third element is structuring debriefing in a very organized way. We have made whether the instructor has made the training in a very organized way, in a very sequenced way. We rate them in a scale of 1 to 7. The various elements, the various dimensions of these element 3s, they have guided a conversation such that it progresses logically rather than jumping from one point to another point. Near the beginning of debriefing encourages the participants to share genuine reactions to the case textbook. In the middle, helps the participants to analyze sections through the thought process. And at the end of the debriefing, there was a summary phase where all the observations listed and related to the case so that the participants could improve their future thinking. It's a sample rating where we are trying to, because why we are doing this dash or dash is a debriefing assessment course. We are trying to find how effective was our training, so that we can future correct. So each dimensions and each elements we rate in a scale of 1 to 7. Element 4 provokes engaging decisions, in-depth discussion. So in this element, we try to create an environment where the student learner is openly asking the question. You create an environment, create a situation where the students can learn. If the students are not able to learn, they may not ask the questions. So there are various dimensions in this elements also where we try to make the interest of the learner out so that they promote in-depth questions. Next slide, please. Identifies and explores the performance gaps. Yes, we have to explore where the weaknesses are there. When we find out weakness, we think everything is right, then we have to find out where we are wrong. Because we have to find out through negatives only we can find out the good. So we have to find out where the pitfalls are, where we are lacking. In this training, what wrong we got, what do we need to improve, so that the next we do, it becomes best. Practice makes perfect. So each element helps the training, last element helps the training to achieve or sustain future performance. So training also with this element, training whether he is able to attain a good performance is also rated in a scale of 1 to 7. Dimensions of this element number 6 help participants to learn, improve, or assess how to repeat to the good performance. Acknowledges the participants and use knowledge of help participants to perform well in the future. Make sure to cover the most important topics in this dimension. So this dash is a debriefing assessment simulation in healthcare where we just want to see how simulation training has been done. We are evaluating how was the effectiveness of the whole core program. When we rate this in a scale of 1 to 7, then we can come to now the future. We have to evaluate ourselves. If we don't evaluate, then we cannot survive. We have to aaj hum kidhar khade. We have to think where our knowledge starts, which area I have to improve. So when we find out through evaluation only, then only we can remodify and re-practice and make the success of our simulation training. So this is the debriefing assessment. So to conclude, yes, simulation training is yes, we have to real life situations we have to create And this is going to be a center pillar in nursing education in the near future. We cannot compromise that. We have to adapt this and we have to learn. Because before going to a real patient and putting him in a danger, it is best to practice in a situation, a simulated situation, rather than creating a mistake in a real patient. Because real patient is a real life where the life is there, where breathing is there, where life is there, it's very precious. So where life is not there, you can think it's not that precious to the society. But yes, it helps to learn. It helps to train us so that we go in a real life situation we do. So it's best always practice in a simulation centers and then go in a clinical setups. So yes, of course, we will be in a very good positions and it will be a very good trained nurses so that we can give a maximum care to the patient industry and we can help the clinical care outcomes. So thank you all.
Any questions?
Yes. Any questions? कब मिलेगा? कब बाहर छोड़ोगे हम? कब बाहर छोड़ोगे यहाँ से? Any questions? आप कब सोने बैठ जाओगे? हम भी सो गए, आप भी सो गए. Learning is lifelong. Definitely, I want to stress you budding nurses. Always be charmed. Always spread the smile across the world. Smile has got a lot of essence. Learning is lifelong. Asking questions will not make you wrong. Asking questions will explore your creativity. Ask why. क्यों आज मैं खड़ा हूँ यहाँ? क्यों बैठा हूँ? पूछने से ही कुछ सीखते हैं. नहीं पूछने से भी सीखते हैं. पूछो. Thank you all. Thank you organizers for inviting me.
Thank you, Binu sir, for your session. इन सारे बच्चे बहुत ज्यादा ही बोर हो रहे हैं या लंच का इंतजार कर रहे हैं. चलो ठीक है, ज्यादा टाइम वेस्ट नहीं करेंगे. अभी आपके सेशन में कुछ करंट ट्रेंड्स सिमुलेशन के बारे में बताया जा रहा था, है ना? और सब लोग बुक के वजह से शायद ज्यादा कंसंट्रेट नहीं कर पाए. ठीक, और चलिए ठीक है, आपके टीचर्स तो यहाँ पे बहुत इंटरेस्ट से सब देख रहे थे और सुन भी रहे थे सिमुलेशन क्या है, एंड दे नो व्हाट इज सिमुलेशन. बट हम ये जानते हैं कि ज्यादातर कॉलेजों में सिमुलेशन क्या है इसको इम्प्लीमेंट नहीं किया जा रहा होगा. और हम आप लोगों से भी, जो पार्टिसिपेंट्स हैं, जो स्टूडेंट्स हैं, आपसे रिक्वेस्ट करते हैं, जो आप लोग यहाँ पे देख रहे हैं, सीख रहे हैं, इसको आपके कॉलेज में जब जाएंगे आपके क्लासमेट से, आपके जूनियर से, सबसे शेयर करिए ताकि वो लोग भी सिमुलेशन के बारे में सीखे. Can anyone answer how many participants can be there in a simulation? To run a simulation, कितने लोग होना चाहिए? कोई एक आंसर आ रहा है 8 to 10. Any more answers?
आज नहीं बताएगा तो खाना नहीं मिलेगा.
जो नहीं बताएंगे उनको खाना नहीं मिलेगा. नहीं, अभी सब लोग नहीं बता रहे तो सबको खाना नहीं मिलेगा. 2, 3, 4, 5 members. Maximum 2. अच्छा, एक सेकंड, अब बाकी लोग चुप हो जाइए. आज जो 2 लोग कह रहे हैं, 2 लोग से क्या सिमुलेशन कराएंगे? Can you give an example? बता सकते हैं आप 2 लोग से क्या सिमुलेशन कर सकते हैं? चलिए ठीक है, कोई बात नहीं, बताएंगे. अच्छा, क्वेश्चंस पूछने के लिए इतना सोच क्यों रहे हैं? बाकी सब लोग हंसेंगे, पहले हंसेंगे, बाद में जो आंसर सुनेंगे ना उसके बाद सब लोग सीखेंगे उससे। तो क्वेश्चन करना अच्छा है, उससे सब लोग एक बार हंस देंगे तो कोई बात नहीं, बाकी बाद में सब लोगों को एक नॉलेज तो मिल जाएगा। चलिए ठीक है, ज्यादा आपका टाइम वेस्ट नहीं करेंगे। थैंक यू फॉर बीइंग प्रेजेंट हियर और इतना अच्छे से सुनने के लिए। एंड नेक्स्ट सेशन।
Thank you, sir. We're taking some short break. I would request Madam Dipti Shukla, Principal of SAMARPAN Institute.
Thank you so much, Venu sir. It was such a brilliant presentation. I'm sure that they learned, but why courage? अभी बताया था ना नवीन सर ने, courage, courage चाहिए। जोश खत्म हो गया सर। How is your जोश? How is your जोश? हाई है? आवाज तो नहीं है। हाई है तो बोलो हाई है।
आप थोड़ा तेज से पूछिए, तेज से पूछिए।
अच्छा मैं भी बोलूं, How is the जोश?
सब आएगा।
Thank you so much. We are lucky that we have our chief guest. He is here in the campus, Dr. Alok Kumar, Secretary, UP State Medical Faculty. So after 10-15 minutes, we will complete our valedictory session. Okay. Then we have a lunch. Then again one last session, and a skill session will be outside. Will be continued. Okay. So just wait for more 20 minutes only. Okay. Thank you. मैं पोस्ट डॉक कर रही हूँ all the physical medical body plays इतना बहुत सारे डॉक्टर्स ने बताया सब चाहते हैं He's taking actions मेरे नाम पे क्या कर दो मेरे नाम से सर आप मिले सर आप सर से मिले मिलवाते हैं सर आप मिले सर से पहले आप वेलकम कर दें फिर हम सबको बुलाएंगे हाँ दूसरे सर भी आ रहे हैं Let the sir come 2 minutes. Operation खत्म किया. Sir Dr. Mukesh Radha is also for the sector of medicine. Now he is attached to be busy and this right.
So taking the program forward, I'm very much delighted to invite our chief guest, Dr. Alok Kumar, Secretary, UP State Medical Faculty. So kindly come over the dais and occupy your honorable seat. May I request volunteers to escort sir to come on stage. I invite our chairman, sir, SAMARPAN, Dr. R.S. Dubey, to please come over the dais. I request our director, sir, SAMARPAN Group, Dr. V.P. Tiwari, kindly come over the dais and take your honorable seat. And I request Principal Ma'am, Dr. Deepti Shukla, please come over the dais and have a seat. I request Chairman Sir to kindly give some symbol of appreciation to our chief guest, Dr. Alok Kumar, Secretary, UP State Medical Faculty. Thank you, sir. I request Principal Ma'am to come up here for welcome.
Jai, a very good afternoon. So, we're waiting for sir to come, and thank you so much, sir, for arriving in the valedictory session. I welcome you on behalf of Samarpan Group and our students to today's national workshop simulation in nursing. We already finished 2 sessions, sir. And now we are going with the valedictorian. Thank you so much for the coming. I request you to please call everyone for the valedictorian.
I request our special chief guest, Dr. Alok Kumar, to please come to the dais and say some few words with us.
Good afternoon, everyone. I am sure that you must enjoy and you must learn a lot in today's session. Respected Chairman Dubey ji, Dr. Dubey sir, Director Saab, Principal Madam Shukla, distinguished speakers, guests, and सबसे ज़्यादा important जो बच्चे हैं जिनमें यहाँ पर सीखने की इतनी ज़्यादा इच्छा दिख रही है, इतनी ज़्यादा ललक दिख रही है, वो एक बहुत ही कहना चाहिए कि अतुलनीय प्रयास है जो कि समर्पण ग्रुप द्वारा किया गया है। मुझे बताया अभी डायरेक्टर साहब ने कि उनके 600 रजिस्ट्रेशन हो गए थे तो उन्हें क्लोज करना पड़ा क्योंकि उनके पास स्पेस नहीं था और उनके अपने बच्चे वहां पर दूसरे हॉल में बैठ के देख रहे हैं। तो आप लोग जो भी जहां से भी आए हैं, मैं नहीं जानता तो आप लोगों को थोड़ा एप्रिशिएट करना चाहिए इस चीज को तालियों के साथ कि उन्होंने आप लोगों को स्पेस दिया और हम लोगों की वो भी है, इंडियन कल्चर भी यही है कि अतिथि देवो भव, तो आप लोग सभी देवता के समान हैं। आज आपका स्वागत है। बहुत अच्छा वर्कशॉप है, थीम बहुत अच्छी थी, मुझे एक हफ्ते पहले कहीं पता लगा जब, तो मैं खुद इंटरेस्टेड था सुबह से शाम तक बैठ के देखने में, क्योंकि आजकल हम लोग जो काम कर रहे हैं नर्सिंग के ऊपर, उसमें ये मैनिक्विन्स का, सिमुलेशन लैब का, इसी का शोर सबसे ज्यादा हो रहा है। अभी जो आप थोड़ा सा बहुत ही शॉर्ट में मैं आपको बताता हूँ, कंडीशन ये है कि जो विदेशी देश हैं, यूरोप हो गया, वेस्टर्न कंट्रीज हो गए, अमेरिका, कनाडा और जो मिडिल ईस्ट कंट्रीज हैं, वहां पर नर्सेस की डिमांड बहुत ज्यादा है। मतलब इतनी ज्यादा है कि आप सोच भी नहीं सकते। इसलिए थोड़ा सा बच्चे जो पढ़ाई करते हैं और अब घूमते फिरते हैं, उसके अलावा इंटरनेट पर सर्च करके भी देखें कि डिमांड ऑफ नर्सेस वर्ल्ड वाइड, ऐसे करके डाल के देखिए। अभी कुछ दिन पहले की न्यूज है, यूके से लोग आए यहाँ पर, नर्सेस को सिलेक्ट किया, 170 के आसपास नर्सेस सिलेक्ट करके वो लोग ले गए। वहां पर वो 3 महीने का उनका रहना, खाना पीना, एकोमोडेशन सब फ्री, और सैलरी उनकी 25 लाख रुपए सालाना, और 3 महीने के बाद जब वो ट्रेंड हो जाएंगे तो 27 लाख रुपए सालाना हो जाएंगे। तो आप इससे अंदाजा लगा लो। ये ऐसा नहीं है कि मैं यहाँ खड़ा हुआ हूँ डाइस पे और मुझे कुछ अच्छा आपको बोलना है तो इसलिए मैं आपको बोल रहा हूँ। आप इसको फैक्ट है, ये चेक कर सकते हैं गूगल पे जाकर। दिक्कत ये है कि वहां पर जो पॉपुलेशन एजिंग की प्रॉब्लम बहुत ज्यादा है, तो औसत आयु है वो बढ़ती जा रही है, लोग धीरे धीरे वृद्ध होते जा रहे हैं। उनकी देखभाल के लिए नर्सेस की आवश्यकता है, जो ऑलरेडी नर्सेस काम कर रही हैं उनकी भी उम्र बढ़ रही है, वो भी उतना काम नहीं कर पाई, तो वो करें क्या? सिस्टम उनके पास बहुत ज्यादा था नहीं। पहले अमीर देश हैं, उनके पास पैसे हैं, बाहर से इंपोर्ट किया, मंगा लिया, नर्सेस चाहिए, मैन पावर चाहिए, जो भी चाहिए, तो अब वहां पर डिमांड बढ़ती जा रही है और मिडिल ईस्ट में कोई अभी सिस्टम बना नहीं है। तो अभी हम लोगों के पास लगभग वही सिचुएशन है जो 1990 के दशक में आईटी सेक्टर की हुआ करती। उस वक्त मेरे साथ ही कई सारे लोग थे, हम लोग बायोलॉजी में थे, तो घर आके मेडिकल में, जो मैथमेटिक्स साइड के थे, थोड़े जो इंटेलिजेंट थे, स्मार्ट थे, वो सीधे कंप्यूटर साइड में चले गए, आईटी, सॉफ्टवेयर, हार्डवेयर, और वो सब लोग बाहर पेंसिल्वेनिया, यूएस, कनाडा, ऑस्ट्रेलिया, वहां पर बैठे हुए। वही चीज आज के जमाने में नर्सिंग सेक्टर की, नर्सिंग और पैरामेडिकल सेक्टर की भी है। तो अगर ये मौका है, अगर आप इसको ग्रैब कर लेंगे, इसको आप चूज कर लेंगे, तो आपका 10 साल बाद लाइफ बिल्कुल दूसरे डायरेक्शन में होगी। और अगर नहीं कर पाएंगे तो फिर आप जहां हैं वहां तो रहेंगे ही रहेंगे, उसमें कोई डाउट नहीं है। कहने का मतलब ये नहीं है कि आप बाहर से चले जाएं, सब लोग सब चले जाएंगे तो क्या हम लोग कौन देखेगा। तो ये है कि जो है, जो इच्छुक है, जो जाना चाहते हैं, उनके लिए विदेश जाने का और विदेश में करियर बनाने का बहुत अच्छा मौका है। अब करियर बनेगा कैसे? जो इंग्लैंड की कंपनी भी आई, जो भी लोग आए, क्योंकि अभी हमारी यूके एम्बेसी से बात हुई है, कनाडा में 2 जगह बात हुई है, कनाडा गवर्नमेंट के साथ हम टाई अप करके हमें गवर्नमेंट का ही चैनल बनाना चाहते हैं। दरअसल उनका क्या है कि बच्चे एजेंसी में, एजेंट्स के चक्करों में इन सब में फंस जाते हैं, उनका पैसा भी बहुत बर्बाद होता है। तो हम लोग सोच रहे हैं कि गवर्नमेंट टू गवर्नमेंट चैनल बने, आप यहाँ की गवर्नमेंट को अप्लाई करें, यहाँ पर आपका टेस्ट हो, स्किल टेस्टिंग वगैरह हो, सिलेक्शन हो आपका, और सीधे आप वहां पर जाएं। होता क्या है, अभी भी ये हो रहा है कि बच्चे यहाँ से चले जाते हैं और वहां पर जाकर परेशान होते हैं। मैं पिछले करीब 1 साल से हूँ काउंसिल में, और मैं देख रहा हूँ कि रोज लगभग 2 या 3 नर्सेस का बाहर जाने का एप्लीकेशन आ रहा है। डॉक्टर महीने में 3 या 4 जा रहे हैं, डेंटल 3 या 4 महीने में कोई एक आदमी निकल रहा है, कुछ इस तरह का सिनेरियो हो रहा है। लेकिन नर्सेस हर रोज 2, 3, 4, 5 ऐसे करके निकल रहे हैं। पिछले 1 साल में लगभग 600 से 700 के आसपास नर्सेस बाहर जा चुकी है। तो ये बहुत अच्छा मौका है। लेकिन आप जाएंगे, आपका सिलेक्शन होगा कैसे? तभी होगा कि जब आपको 2 चीजें आपको बहुत अच्छे से आनी चाहिए। पहली चीज लैंग्वेज, आप जिस भी कंट्री में जाएं वहां की आपको लैंग्वेज वहीं के लोगों से बात करना है, तो मोस्टली इंग्लिश है, या इसके अलावा जो भी स्पेनिश है, जो भी कंट्रीज है, मिडिल ईस्ट कंट्रीज में आपकी हिंदी चल जाएगी, कोई दिक्कत नहीं है। लैंग्वेज में आपकी कोई मदद भी कर सकता है, कोई असिस्टेंट भी कर सकता है, वहां का आपका कोई दोस्त होगा, सीनियर होगा, वो बता देगा। लेकिन स्किल तो आपके पास अपनी खुद की होनी चाहिए। और उसको आप डेवलप कैसे करेंगे? डेवलप करने के 2 ही तरीके हैं, या तो आपको इतने पेशेंट्स मिले जिनपे आप अपना क्लिनिकल प्रैक्टिस अच्छा कर सके, जिसको मतलब आम भाषा में कहते हैं हाथ साफ करना, कि आपको एक पेशेंट मिले कि आप उनको करें, देखें, उनको कर पाए, प्रोसीजर्स कर पाए। और ज्यादातर प्रोसीजर्स पेनफुल होते हैं, कोई भी पेशेंट आपको ऐसी हाथ नहीं लगाने देगा। तो एक ही तरीका बचता है कि आप सिमुलेटर्स का काम, जिस तरह से जो हमारे पायलट्स होते हैं उनकी ट्रेनिंग से पहले उनका मैंडेट होता है कि उनको 8,000 घंटे या 10,000 घंटे सिमुलेटर्स पे काम करना पड़ता है, सिमुलेटर्स पे चलाना पड़ता है, वो रियल फीलिंग ही आती है उस तरह। तो वही आप यहाँ करें। यूपी में अभी तक कोई ऐसा अच्छा सेंटर नहीं था, कहीं ऐसा नहीं था। गुड़गांव में था, जहाँ से मैडम आए हैं, फैकल्टी आए हैं बताने के लिए। हम लोग कोशिश कर रहे हैं कि यूपी में भी किसी जगह पे, और मोस्ट लाइकली यही समर्पण कॉलेज में ही हम एक अच्छा सेंटर बनाने की कोशिश करें, जिसमें आप लोग आए ट्रेनिंग में और अपने सेंटर पे जाके ट्रेनिंग में। तो वो अभी डायरेक्टर साहब से भी डिस्कस हुआ है, डॉक्टर साहब से भी डिस्कस हुआ, तो कोशिश कर रहे हैं। लेकिन सिमुलेशन में भी आप लोग ध्यान रखिए, ये मान के चलिए कि ये वाकई में लाइव पेशेंट ही है। होता क्या है, बच्चों को लगता है तो सिमुलेट वो है, मैनुअल पड़ी हुई है, कैसे भी हम लगाते हैं, दाएं बाएं कुछ भी करते हैं, वैसा नहीं चलेगा। आप उसको लाइव ही मान के चलिए, और उसमें जितना भी अच्छे से अच्छा सीख सकते हैं सीखिए, जो प्रॉब्लम आ रही है वो पूछिए। क्योंकि अभी कुछ दिन पहले हम लोगों ने टाई अप कराया था कुछ कॉलेजेस का, यहाँ के बड़े बड़े हॉस्पिटल से, अपोलो हुआ और बाकी जो है मेदांता वगैरह, वहां से। तो उनकी प्रॉब्लम यही आ रही थी कि थोड़ा सा बच्चों में अभी स्किल की कुछ प्रॉब्लम है। तो अब जब भी आपका टेस्ट होगा, जो भी एजेंसी बाहर से आएंगी, जब भी सिलेक्शन होगा, तो ये चीजें तो आपकी परफेक्ट होनी चाहिए। तो डेफिनेटली अपॉर्चुनिटी बहुत अच्छी है, बहुत बड़ी है, लेकिन आपको उसके लिए तैयार होना पड़ेगा। ऐसा नहीं है कि वो आएंगे, जैसे यूके वाले आए थे तो मैंने करीब 800 या 1000 नर्सों का इंटरव्यू लिया, उसमें से 170 को सेलेक्ट किया उन्होंने। तो जो बेस्ट से बेस्ट होगा उसको सेलेक्ट करके वो ले जाएंगे। तो आपके पास अपॉर्चुनिटी खुली हुई है, अपार संभावनाएं हैं। आप यहीं पर रह के काम करिए तो भी, अच्छे कॉर्पोरेट हॉस्पिटल्स हैं, बाहर जाना चाहते हैं तो भी। तो इसमें आप मैनेजमेंट वगैरह का स्किल लेवल में आपने काफी कुछ सीखा होगा, आगे भी मौका मिलेगा। और मैं रिक्वेस्ट करूंगा दुबे सर से कि आगे भी इस तरह की वर्कशॉप आयोजित करें, बल्कि एक सेंटर बनाने की पहल करें, कोशिश करें, जैसा गुड़गांव में सेंटर है उसी तरह का यहाँ पर भी डेवलप हो जाए। अभी दिलीप साहब आए थे, उनसे भी बात हुई थी इन सब चीजों पर। बहुत सारे मुद्दे हैं, कुछ प्रॉब्लम से आपकी सॉल्व हो सकती है, कुछ नहीं हो सकती है। ट्यूटर्स का रेशियो का है, बहुत बड़ा इशू है। तो उसमें ये एक आइडिया दिया गया था कि जहां पर ट्यूटर्स नहीं मिल पा रहे हैं या कमी है, तो वहां पर कुछ इस तरह का कर दिया जाए कि भाई अगर ट्यूटर कम है तो हमारे पास उनका लैब है, लैब में सिखा रहे हैं, कंपनसेशन उसका लैब से हो जाए। तो इस तरह के आइडिया चल रहे हैं। जल्दी से आने वाले समय में बहुत कुछ आप लोगों के लिए अच्छा होगा। और ज्यादा आप लोगों का मैं समय बर्बाद नहीं करना चाहता, मैं बीच में आया, इंटरप्ट किया, सॉरी फॉर दैट। और आपको बहुत बहुत बधाई और शुभकामनाएं। धन्यवाद।
So let's start the valedictory session. I request our chairman, sir, please honor with small token of appreciation to our speaker, Madam Anu Grover. Ma'am, please come on stage. So, thank you, sir. Thank you, ma'am. To facilitate our next speaker, Dr. B. Nujo, I request Jarika sir to do the honor. Volunteers, please. Now request our chairman, chief guest, please honor with small token of appreciation to our next speaker, Professor Priscilla Sampson, Principal Ma'am of Eram Nursing College. Assembly suggestion. I request Mr. Navina J.H., our chairperson, for the first session, please come over the dais. And I request our chief guest again, Alok sir, please kindly felicitate our chairperson. To felicitate our next chairperson, Mr. Santosh S.U., I request again our chief guest, Alok sir, to do the honor. So I request our director, sir, please, a few words to address.
Dr. Ralo Kumarji, Secretary of the State Medical Faculty, and Chief Guest of the National Workshop from Civil University. We extend our hearty welcome to you, sir, at this campus. And I know that you are very ready to attend discussion from the very morning. But being a government servant, we know how difficult it is to do that thing. And because of the certain commitments, he was not able to come in the morning. He was in a meeting with the DG and me. But he made it sure that he will definitely come here and be among us. I am highly thankful to Dr. Alok Kumar that he has given this idea that the first nursing simulation center in UP should be established at SAMARPAN. On behalf of SAMARPAN management, sir, I assure you that definitely we will do this and we will try our level best to have a simulation center here with the help of UP State Medical Faculty
and active cooperation from SCT University Gurgaon. Because they are the first in India to have the center and they have all the expertise. And now I am very much sure that SCT will extend all sort of cooperation towards to have the center here. And we have very good relationship with the medical faculty, everybody. And since Secretary himself I told, so I am very much sure that we have all the cooperation from the government of UP and UP faculty to have this center here. Since we have very short time, I again extend my heartfelt thanks to Madam Grover, Dr. Binoy, Professor Islam, the chairperson, Mr. Santosh Yasu, Namina sir, Jagdish sir, and all the degree present here. The time was short, but I am sure that our budding students must have learned many new things from our experienced speakers. We have students from different districts, from different nursing colleges of the UP. Since because of our limitations of this hall and logistics, we were forced to close the registration once it was over 600. I told you that our students are not here, and we have a student from about 10 different districts of UP here, and some other are attending this online through Zoom link from other states also. Because the topic is like this, and when we have speakers like Madam Grover or Dr. Joy, definitely everybody will like to join this. And since we have a dynamic principal in SAMARPAN, so I am very much sure that soon she will have enough time and she will organize a similar, not only one day, I think one day to start, for such type of people. Because whether it is pharmacy nursing or it is simulation, because these are the new fields and you need to have some time to grasp. One day you cannot grasp everything. So I will request my principal that whatever knowledge he is having, he is very dynamic leadership qualities he is having. And she also, now I should disclose that she is going to have very soon an international conference in this. Planning to go to India, but I think in next coming 6 months, we will be able to have that in the conference campus. And whatever support Dr. Sukla will require from the management, that is, she can take a target under that in also. And since we have faculty and students from other colleges and from other districts also, so I am happy to announce that we are having the first national conference on forensic nursing practices in this very hall on 8th April. So I will request you all to kindly join us in that conference also. Alok Kumar ji is here. Actually, I was very late. I think I approached him only yesterday. That we forget to apply for this workshop, and he was very kind. Immediately he called the Babu and told me you just prepared results. So for today's workshop, he gave 2 credit points. And the next conference also, credit points are there. Since it is a one-day conference, so I per rule, we have only 2 credit points. So 2 credit points for today's workshop and 2 credit points will be for the conference, one-day conference we are going to have on 8th April. So that is a credit to you. So I will request you on behalf of SAMARPAN to attend that conference and come over here, because forensic nursing is also very, very fast growing field in nursing. I think in UP, we don't have this forensic nursing education in at least Uttar Pradesh. I think we have only in Punjab. I think Dr. Goria will be there. Everybody knows about him when we are talking about forensic nursing. And Maharashtra, they have started. So I was talking to Alok Kumar, because Dr. Goria, everybody knows when we are talking about forensic nursing. So he is having Punjab and I think second state in Maharashtra. And now my chairman, Dr. Anas Dubey is here. So I am proposing that we should have this branch of forensic nursing MSc. We should open this forensic nursing in SAMARPAN also. And I prefer that innovate anything, whatever you propose, they will accept. So I know that he will definitely take you. I know the problem can go. So I was talking to secretary medical faculty 2-3 before. So he told me that you should start pharmacy nursing and you should be the first college in UP to have pharmacy nursing course also. So sir, I will take your word forward. And SAMARPAN is committed to be a role model for the nursing colleges, especially in Uttar Pradesh. And we will take all sort of measures to improve the quality of nursing education in our college and in Uttar Pradesh. With these words, I will take much more time. I am thankful once again to each and every person present in this hall. And I thank you on behalf of those who are talking. Thank you very much.
Thank you, sir. Now request our respected chairman, sir, Dr. Naresh Dubey, to speak some precious words.
Professor Dr. Alok Khawaji, our chief guest. सुबह हुआ बहुत कुछ बोल चुके हैं, सर बहुत कम है, मैं समय ज्यादा नहीं लूंगा। अपने मेहमानों के बारे में आप कहीं पूछ चुके हैं, मैं सबसे अभी हमें कुछ बातें मालूम पड़ी, बातों में जो कि मैं सॉरी कि मैं आप नहीं पाया था, तो संपूर्ण को बैठे हुए थे, मैं I have to go with the operation being surgeon, तो मैं बगैर ऑपरेशन के रह नहीं सकता, मेरी हैबिट है, तो मुझे जब मौका मिला मैं चला गया था, मैं भी 2-3 ऑपरेशन करके लौटा हूँ, तो पता चला काफी आए, पहले प्लान किया सुबह करके आऊंगा, प्रोग्राम चेंज कर दिया, तो अलग मुझे करते 40 साल से ऊपर हो गया करते हैं, did my MSc in 70 and worked in so many places in Uttar Pradesh, then in medical college and so many places, but still surgery I used to do it, and I started this SAMARPAN. I will take only 5 minutes, not only that. Don't get bothered with that too much. When I got retired, I thought I should do something. I was one person due to my hard dedication work. For the first time in the history of UP government, I got an extension of 3 years in medical services. Because I got NABS done of Arnold Hospital, Lucknow. That was the first government hospital in Uttar Pradesh, not in UP, but in India, who got accreditation certificate, NABH. Gradually, I got so many things in my life. I'm not going to tell about that. But the only thing I wanted to carry my thoughts to you that I started this institute with a hope and dedication. SAMARPAN, as the name indicates, it's only SAMARPAN. That means full dedication to this profession. अभी डॉक्टर कॉल कर रहे थे, तिवारी कह रहे थे कि आप शुरू कीजिए। अभी मुझे बताया सुबह में कह रहा था, मुझे हिच था कि पता नहीं यूपी में किस तरह शुरू होगा, क्या बातें होंगी। डॉक्टर शुक्ला ने कहा कि नहीं हम सब शुरू करना चाहेंगे, go ahead with that, हम करेंगे, हम go ahead with that। और जब आप मैम आपकी पहली बार फिल्म देखी हमने, जिसमें कि ये I was very, I felt bit encouraged। And अभी जब आपकी बात सुना कि डॉक्टर कुमार जी आप why not here? So I can assure you कि once government supports me, just mentally, physically, and everything, whatever can be done, I'm ready to start it. And this might be, I will take also this as a dream to start here simulation life in this campus. Second part, because I have no have any hitch. I need persons to work. I need persons to cooperate. I need persons to teach my friends and other friends in UP or anywhere to impart a good knowledge, good practice, to produce a good standard ideal nurse. These are dreams which are being fulfilled by government today. I was thinking all these things about 5-6 years back. I started about 10 years, 11 years back, 13 years back. This was I retired in 2009. Then I started here working in small institution, coming this place. So, with my full dedication, I can assure you, Dr. Shukla, Dr. Tiwari, Dr. Gawalji, are my guests. Whatever you want from me, I'm ready to fulfill that. Thank you very much. Thank you. One thing, I have to ask you about forensic, of course, Yes, you give me to that pharmacy course. I will make a structure. I will write it. And once he gives me, I will start it. No issue. Thank you.
I request Chairman Sir again, please honor with small token of appreciation to our chief guest. Wind up the valedictory session. So I think everyone having a little bit of hungriness. So let us start our lunch session. I request our volunteers to escort our chief guest and VIP guest to the
अभी अक्टूबर में करेंगे ना।
Respected speaker already have covered the topic of the session. Session 1, simulation in nursing, and session 2, the current trends in simulation, evolution, and research. So we are moving towards our next session. Next, session 3, role of simulation in nursing education and practice. I request our speaker, Dr. Priscilla Sampson, Principal Ma'am, College of Nursing, Mera University, Lucknow. Ma'am, please kindly come up on stage and occupy your honorable seat on dais. I request Dr. Deepti Shukla, Principal Ma'am of SAMARPAN, on the stage as the chairperson of the session. Ma'am, please come up on stage. And have a seat. So before we start the session, I'm just giving a brief introduction of our chairperson. Dr. Deepti Shukla is a highly experienced nursing professional who has worked in various leadership roles in the field of nursing education. She is currently working as a professor cum principal at SAMARPAN Institute of Nursing and Paramedical Sciences in Uttar Pradesh, India. Ma'am has also served as the head of department at Panna Dhai Ma Subharti Nursing College in Meerut, Uttar Pradesh. Additionally, she has worked as a principal at FH College of Nursing in Tundla, Agra, UP, and as the officiating principal or assistant professor at SLM College of Nursing, Mount Abu in Rajasthan. In the early days of her career, Ma'am worked as a nurse in charge at SGH in Amethi, UP, and later at VPC in Lucknow, UP. With her vast experience in the nursing field and her passion for education, Ma'am has contributed significantly to the development of the nursing profession in India. Ma'am has completed 3 applied post-graduation diploma programs in human rights from the Indian Institute of Human Rights in New Delhi. With her strong academic background and diverse expertise, Ma'am is well equipped to make significant contribution to the field of nursing and human rights. Ma'am is highly accomplished professional with several patents and copyrights to her name. She has received 3 patents for her innovative design, including the KD vaginal reflector, the postpartum abdominal binder, and the strap pin, all of which have been registered in the Patent Cell of India and Swami Vivekananda Bharati University. Additionally, Ma'am has applied for 3 patents that are currently in the review section of the Patent Cell of India. In terms of copyright, Ma'am has registered 5 copyrights with the Copyright Cell of India and has applied for 2 more. Her expertise in the field of nursing education has been recognized by various institutions, and she has participated in several faculty development programs focused on ICT tool, research methods and techniques, emotional intelligence, and e-learning courses. Ma'am is also an active member of several professional organizations, including the Trained Nurses Association of India and the Society of Midwives India and the Nursing Research Society of India. Her contribution to the nursing profession in India is significant, and she continues to inspire and mentor future generation of nursing professionals. We welcome you, ma'am. So now I request ma'am, Dr. Deepti Shukla, to come over here and introduce our speaker, Priscilla ma'am. Thank you so much, ma'am.
Good afternoon. So today we have our third speaker, Professor Dr. Priscilla Sampson, PhD in Health and Hospital Management, PhD Nursing. So having more than 25 years of experience, Madam obtained her graduate and postgraduate nursing degree from Christian Medical College and Hospital, Vellore, Tamil Nadu, India. She has also completed a postgraduate diploma course in Health and Hospital Management. She was awarded her PhD from Warden University, that is in USA. Due to her interest in mental health, she completed a dissertation for PhD in stress, anxiety, and depression besides mental health. Madam is a highly qualified and accomplished nursing professional with a rich academic background and significant achievements in the field of mental health and nursing education. With over 25 years of experience in nursing education, she has served in various positions and posts, contributing to the growth and development of the nursing field. Her research and publication in national and international index journals have been well received, and there are more than 80, and she is highly regarded in the academic and nursing commitments. As the current, she is a principal of Era College of Nursing, Era University, Lucknow. Dr. Prisla is continuing her missions to strengthen the quality of nursing education and enhance research habit among nurses, while also implementing studies to improve the mental health of the nursing student. We welcome you, ma'am, for the third session.
Good afternoon, everyone, and thank you, Dr. Deepthi, for this introduction. And welcome all to the post-lunch session, which is much relaxed, and I think I'm prepared to see many people closing their eyes and sleeping. So, but I promise that I will not bore you down, because the speakers before me, they have covered most of the things. So I will only highlight on the things that experience, I will share certain stories and the experiences in this field of simulation. So I promise not to bore you. Being a formal thing, I would really like to thank SAMARPAN Institute, and I'd like to thank Dr. Deepthi for inviting me over today for this workshop. I also thank you, the patrons of this workshop, Dr. Dubey and Dr. Tiwari, and all the other dignitaries from other principals and faculty and the dear students who are our future, of nursing. So without wasting time, I would like to just show you a brief video clip, which is 3 minutes. And I'm telling you, this is not a commercial advertisement. It is Era University, of course, Era University, because I belong there. And what we are doing in the field of simulation, that I would just like to project in 3 minutes video clip, and then I will talk about other things.
True Form Games. At the World's Changing Ideas Summit in New York on 21st October 2014, Google's former head of research, Alfred Spector, emphasized how advancement in gaming technology can enhance the process of learning and prove to be potentially supportive in educational prospects. True Form Games is a company dedicated to enrich the educational experiences of individuals by providing them with an immersive, interactive, and integrative platform where gamification of the learning components leads to new avenues of well-being and development. It upgrades the knowledge-based as well as skill-based aspects of lessons, be it in the medical or technological sector. Our tailor-made games train students in managing patients in different clinical situations. These video games are playable on PC as well as on mobile for both Android and iOS platforms. They are developed in a way as to address the clinical aspect of the MBBS syllabus in an immersive way. They are available as a series of mini-games which can be played in silos or as a comprehensive virtual package known as the MedLife. The most remarkable thing about the MedLife is that this product would be a trendsetter, being the world's first MMORPG designed to take care of the entire clinical and practical side of the medical curriculum. In this medical game, like any other video game, after login, the player can customize his or her avatar as per preference. The game progresses level by level as the player attains scores by selecting the right answer from the options given to choose from under the queries. Every next level presents a more difficult phase of a medical situation and its management, but it greatly helps in its objective of making the player aware of step-by-step advancement of the medical ailment and the relevant procedures to follow as treatment in an easily understandable manner. The medical game correlates with multiple learning objectives and provides opportunities to read in higher level thinking. Interaction with other players occurs during gameplay itself. It presents a series of mini-games, each dealing with separate medical procedures for the players to play and learn at the same time. It is worthwhile to note that the company manufactures its own customized mannequins that are required in the clinical study of medical education. Our innovation is based on competency-based medical education to produce competent, skilled doctors for the future to reduce or eliminate high mortality rates due to medical errors. In this, multiple clinical skill-based yardsticks are incorporated. By switching to this innovation, real patients, cadavers, and clinical situations in real time are not necessary. The clinical situation can be created, discussed, taught, learned, and evaluated. Our infrastructure allows students to log in with their respective punch IDs and then carry out the clinical procedure on the mannequin integrated with the game portal. The integration allows for the score of the student to be displayed on the video game of that very procedure. A log is automatically maintained for each student because of biometric attendance. The risk-free trial and error promotes frequent and regular practice that leads to attainment of competency.
So this simulation is a gaming simulation that was initially started for the MBBS students at ERA. But this year we have taken our BSc first year students and we have started doing this simulation. In this simulation, as you have seen in the video clip, so the mannequins are used and also the gaming, and it goes simultaneously. So our BSc first year students have enrolled, they have their own IDs. As you have seen, they created their own avatar and they practice the simulation. So this is one kind of simulation that we are using, which is gaming simulation. And I do not know the results right now, but we need to do research and we need to find out whether this is going to be effective means of students learning, because 8 students have a phone now. So they download this in their phone. As you have seen, it's Android or iOS, whichever phone you are using. And students in the class, they are given every Saturday and they practice that. So this is just a starting that we are doing. And coming to, so I just wanted to show that we have started, and I hope to share with you in future the effectiveness of this program that we are starting in simulation. Now coming to my presentation here, the topic for me is role of simulation in nursing practice and nursing, education. We all have seen since morning that simulation is very much needed. It's a need of an hour. We have been telling since morning. And with the quality improvement, this we need to do. There is no option here. I feel there is no option whether we should do it or we should not do it. It is must that we all should take this for our students and before that to the faculty, so that we need to get oriented what simulation is. So I'm not going through this because we all have heard what simulation is and definition and this background. So background of simulation is the first mannequin. I don't know how many of you know that was first introduced. It was a life-size doll, like a adult human body, and that her name was Mrs. Chase. And Mrs. Chase was built in 1911 by Martha Jenkins Chase, and on her name this mannequin was named. And this mannequin was just how to dress them, how to turn their position, all those things nursing students were learning. So this was the first thing, which innovation that happened in nursing field with a mannequin. When I joined BSc nursing, it was in 1990. I joined nursing and I did my BSc. And that time, when first time I went, I came across, I don't know how many of you who have done nursing, there was somebody called Miss Annie. We started practicing on Miss Annie, and that was the only mannequin I remember, we had it in our lab. And there was a time when we were doing fundamental of nursing, and our instructor, she asked, who wants to be volunteering for NG tube insertion? I have no idea what is NG tube insertion, and I raised my hand. And you can imagine NG tube insertion, and those days they were using the rubber tubes. I don't know how many of you have seen those rubber tubes. And it was set up for me, and I literally had to swallow that, and I was crying, and with me, my classmates were also having tears because they could see the pain in me. So thanks to simulation, that we don't have to go through those painful experiences, getting IM by our friends, or, so we are safe from that pain. And I never forget. After that, whenever I saw a patient with NG tube, I knew how it would be, when we are inserting, because I hear some nurses shouting, swallow it, move kholo, aise karo, and then you don't know what the agony the patient, so the pain, that you could feel that. But we have better alternative now of simulation where we can practice on the simulators that we are having it. And so now emerging need for simulation is, we all said, I'm not going through this also. Everybody knows there is a big gap. If the gap is becoming wider and wider every time, from the time when we were graduated in nursing and from we see the difference. Everybody in the hospital say, oh, nursing care has gone down. Nurses know, they are knowledgeable, they will give you answer, but when you ask them to perform, they would not be. So there's a wide gap between theory and knowledge, and that is why we need that. Then ethics. We all talked about ethics. Now everything, we cannot harm the patient, we need to protect them. So ethics is very, and patient's right. If the patient tells you, no, I don't want this to be done on me, they say, you take a group of students, they say, sister, disturb mat kariye, mujhe sone dijiye, aaram karne dijiye. We have to respect them. So all those issues, the ethical issues, patient privacy, patient's rights are all have kept in mind, and that is giving the rise for the need of using simulation. Benefits. We all know that benefits are learner-centered approach, guided by learning theories. Who can recall morning class? What theories did we see in the morning class that backs up the simulation? Cox model, exponential learning model. Anything else? Okay, anything else? What model? Heinrich model. Okay, good. And there is another theory, learning theory, which is called constructivism. Those who are studying education would know what is constructivism. That theory is also, backing up the construct means to build something. So we are learning through simulation. We are having our own way of learning, and we construct those ideas in simulation. And also, availability of patients are very scarce. And in my hospital, I don't know about other hospital, ERA is a huge hospital, 850, 900 bedded. But still, we are running so many programs. There are so many MBBS students, there is a PG medical students, there is nursing, there are a lot of other programs going on. And then we don't get, so there's a fight to conduct a delivery, or there's a fight to do a dressing, So those fights, we don't want to fight with anyone. So it's better to take simulation and learn, So that way, everybody will get a better chance. Another thing I want to say is that when student is not able to perform, we get people, faculty we get when they come to apply for jobs, and they are not able to perform simple skills. And we blame them, we scold them, where did you study? Why don't you know only this simple thing? But I think we can't blame the students because they didn't get the opportunity. So this is the time with simulation that we can grant each and every student will have a chance to practice or learn through simulation. So nobody can say, like suppose how many of you in your student life have seen or given a care to a dying patient, end of life care. I don't think every student, if we have 80, 100, I have 100 students in GNM program. Very 1 or 2 or 3 students probably see us, they get a chance to give end of life care. So where they can learn that? In the simulation lab. So these are the needs that we need to focus on, very practical things that we need to understand, that those procedures we don't get, our students don't get. Earlier, what used to happen? Okay, you did not get this patient, so teacher will call you in the library, she will ask you viva, she will ask you certain questions, and she will sign your procedure book. We are not testing there clinical competence. We are just testing their knowledge and we are signing them their logbooks, but they're not learning anything. They're going without having any clinical competence. So simulation is needed so that all the students will have equal chance of learning all the things that are required of them. Then video recording. So simulation is also giving us a chance where you can actually record the whole scenario when students are practicing, simulation is going on, so that they can see it later on. The teacher, the facilitator can also see what could have been done. So it is like self-evaluating. Students can play those videos later and see, okay, I missed this step, or I did not talk, or my communication was lacking. So it's like a review for them. So simulation also gives chance to record those videos for the reference and learning of the students. So you don't have to be told, students don't have to be told what is right, what is wrong, you missed here, but you can see and match with your checklist that you are using in your clinical areas. Then reflection, very beautifully, Anu ma'am has already said, so I'm not going into it. Psychological safety. You know, I can relate as a student. When I was a student, there were people who were, and I myself was so scared to go to the real setup in the hospital. First year students, how many of you are, anybody's here? First year? Probably all senior ones get the chance to come. But you can remember your first year days when you went to clinical areas, how much fearful and anxious you were. What should I talk to the student? Doctor will come and scold me if I do something. If I have not set up the trolley, teacher will come, clinical instructor will come and shout in front of the patient and relative. You know, your respect will be also on stake. So we are fearful, always constant anxiety. So what happens? Many students quit and go. Some will fall in the ward. How many of you have fainted in the ward? You, okay. 1, 2, most of you are very strong then. OT people go, they faint there. Okay? They go and see a delivery in labor room, they faint there. Because they're not well prepared. You know, suddenly you are just sent in front of some, giant. You will feel exhausted. You will feel that, where I have come, I cannot move. So that's psychological safety. So mentally also, because I am from mental health background, so I really focus a lot on mental health. So I can see students suffering, anxiety. Some will become sick. Absenteeism will take place. We are not going because I'm scared, because I have to go for clinical duty. So they will make excuses. I have a headache, I have fever, I can't come, and they will miss out their clinical duties. So to overcome all those things, simulation is the best. So students are, heavy. They're not heavy-hearted. They will learn by gaming, by all the simulations, and they are not feared that they are harming anybody. Okay. Then you may not counter, I already told you, you can practice those things which you will not get procedure, in those 4 years or 3 years of your training. Immediate feedback. Now teacher, most of us are feared. If somebody scolds us in front of board, many students have come and told me, ma'am ने मेरे से इतने खराब तरीके से बोला patient के सामने, वो मुझे बाद में अलग से भी बुला के बोल सकती थी, लेकिन उन्होंने मेरी respect नहीं करी. Nowadays, everybody, even our children, our small kids, if you have children, they will not do things. They will become stubborn. They will say, "Aapne mujhe kyun daata?" दूसरे के सामने आपने मेरे insult क्यों की? So we cannot. But when the simulation is there, you are in that simulated, that comfortable environment where you can correct your students and where they will feel respectful, where they can feel that they are guided and not be shouted in front of the, other medical people or other patients and their relatives. So safe environment is very much needed and feedback can be given very. Now, current use of simulation in nursing education. This I have referred some papers, some research papers where I have come across these. So I have kept, I'm sorry, but I have kept mental health first because that's close to my heart. So in mental health, we don't have, we talk about, we have actors. You can have actors or, you call them standardized or simulated patient SPs, you call them, they're tailored patients. I remember when I was doing my masters in Vellore, we had 10 station when we had physical assessment, and it was a 50 marks, stations. We had 10 stations, and we were not told that these are the actors. The actors were kept on each station, and there was so it was one for mental health, OBG, all the specialty. And I still remember there was a man who was the actor, and we did not know that he was a real actor, but we thought he was a real patient. So the way he acted like an aggressive patient, and you had to manage that patient. So you can have those kind of things in mental health also. And end of life care, as I was saying, that not many people have the opportunity. So many, these are the areas, these are the current scenarios that you can give your students is end of life, patient care, all their family. When we say end of life care, it's not only we are giving care to the patient who is dying, but also very important aspect is the family, how we are preparing them. So communication skill is a very, very important aspect of any simulation, without, and students not only learn how to do, hands-on skill, but how to communicate. I would say that after simulation, it is, your development completely, how you communicate, how you work as a team, teamwork, as ma'am also in the morning, she's insisted on that. Teamwork is very much important because helps in a health team when the one person cannot manage the scenario. So there we learn that. Disaster training and preparedness. How many of you have done training on this? Disaster preparedness. And so basically in hospital, the medical record, MRDs also, they get to, do this. So there are a lot of, now, pandemic happened. Preparedness about that. Next pandemic may occur, some other virus may come. Those kind of preparedness, how drills we do it. In schools nowadays, they're teaching simulated drills to our children, where they say earthquake. I was in Nepal for many years, and it's a very earthquake prone area. So in schools, our children will get every 2 months, they will get how to get prepared for. So when the 2015, when we have a big earthquake in Nepal, the school children actually were teaching. It was a Saturday, and Saturday is a holiday in Nepal, like how Sunday it's in India and other places. So everybody was at home. Children, schools were closed. That was by God's grace. Otherwise, it would have been even bigger disasters. So children, my son, he was little that time, and he told me, Mama, everything was our CDs and everything was flying in the room. So we couldn't understand what's happening because we have never been to such a earthquake. And my son, he was small, and he said, Ma, it is probably something is happening. So he went under the table. He said the drill was taught to us that we have to be prepared like this. I have never done an earthquake drill in my life. And he was telling me and my husband that, Papa, you should do that. Mama, you should do that. And he was in 2015. He was 15 years old at that time. So, these things have such an impact. Any simulation has such an impact that you don't have to read every time. Or memorize. This step becomes discussion. So these are the things that disaster trainings, role of triage, teamwork. Okay, so these how to respond automatically, in the disaster, panic situation, how to work. Now, other scenarios where we can have a role of simulation is ISBAR. How many of you are familiar with ISBAR? How many of you have used ISBAR in your working setups like ICUs or in emergency? Anybody who has used ISBAR? Okay, very good. Okay, so if you have not, I would encourage you to read. There's lots of articles on ISBAR, and you can start in your own setups ISBAR. Here you can see that introduction, situation, background. This is like a reporting system. Suppose you are working in an ICU or in any setup, and you come across that patient is having some symptoms. It could be some acute symptoms patient is, and you want to report it to your senior nurse. Like students want to probably tell the ward in charge, or you're on call, you want to tell the duty doctor. So you can use the ISBAR reporting. Okay, so this is also like a simulation we can act out. So I learned this bar as a simulation only, where we were made the situation, we were given this situation in mental health. So, PFA is there, psychological first aid. So here, what introduction you will give? Suppose I'm calling, I'm reporting to my senior nurse. I have to introduce who I am and about whom I'm reporting. Okay, so there's a process and what is wrong, what is happening to the patient, background of the patient. Suppose you're telling the doctor, okay, or your senior nurse, okay, he's having breathlessness, BP is so much and so much. But who? Who is the patient? When he came? What is his background? So this is kind of a simulation that is being used for other, and simulation, this ISPA can be used anywhere. I'm not going to take a class. There's a whole class that you can attend for ISPA. If you're interested, please read on and utilize it in your own setups also. It's a rating also. I told about PFA, psychological first aid. This started especially in disaster. WHO is doing trainings of PFA. This was also completely simulated. So you have a scenario where you are given a scene like a disaster you can get, or death of somebody, loved one in the family, or road traffic accident. You can also use in your emergency situation where the family rushes in with a patient with head injury or any injury, and they are in a panic situation. We use PFA. So in the PFA, everybody knows first aid. But how many of us has done psychological first aid? If you're interested, again go. There's a training. 7 days training, 15 days training, WHO is conducting. Red Cross also has initiating now to do this. So because of the disasters, and especially when COVID pandemic came, many people took online trainings, and those online virtual trainings also were based on the simulation. Then is the surgical dressing, vaccine, all the invasive procedures or painful procedures there is a role of simulation in that. Labor and delivery, everybody knows. You just can't go and conduct, a delivery if you have no idea. I was very scared. That was the scary thing for me. So anybody who says I'm from OBG, I have a great regard and respect for them, because I was very scared to enter the labor room, because I was always thinking I'm going to harm, the mother or the child. हमेशा वो डर लगा रहता था कि अरे नहीं गलत खींच लिया बेबी को तो कुछ हो ना जाए. That fear, the panic was there. Now I saw the simulation labs. I feel it's so good. Students are so blessed. So I would encourage the students also. Your labs are so good. यहाँ पे है, जिनके colleges में है, जिनके नहीं है. I think faculty should also tell the management to get and get that skill, so that when you are going to a real life situation, you will be bold enough to do and not be scared like me. That something is going to happen. Then all the other procedure, catheterization, for all these things, simulations are there. I think some of you must be using it. And of course, my favorite nasogastric insertion, I have written there, where I was like a person who got through that. So these are some other scenarios. Next slide, please. So these are some pictures I got from our lab. Okay, we are using this, and I think you saw in the video clip also. These are simple ones. They are made in ERA. So ERA University, we have a simulation we manufacture. We have and we get those. They are cost effective, and they are making their own there. So our students can practice. So we have also started using some of these, so that because they are cheaper and more, if anything goes wrong, we can get them prepared there. So in our lab, we have these simulators. They are simple, low fidelity, but students are really, they are much relaxed learning on them. Future challenges of simulation in nursing education. So virtual simulation also was talked about. Okay, virtual simulation is also very important. And nowadays it's more, because everybody cannot gather in such things. So virtual is more becoming popular. Trained educators is the also need. Students are ready to learn, but the teachers are few who have gone through this training. So I'm really encouraged to see here. I've met people who have gone through this training, and so every college should see to it that you go for this training, and we become. And now SAMARPAN here is giving us such a good. If they will start, then many of us our colleges also can come and get trained here. So faculty or educators need to be really trained as the future. Investment of funds. It may be that one-time investment is required and maintenance is required. So we need committed people. You know, you just buy all kinds of model, and I saw your lab in the College of Nursing. I'm very impressed. Very good. But you know, how dedicated we are to keep up the maintenance of those. Who is responsible? You know, so even students, I would say, when you're practicing on those, just see that you take care of it like your own baby, okay, like your own possession. Then only you can, you know, learn. This is one thing that we learn in nursing. You know, when we do any procedure, what we do? Collection of equipment, and at the end, how you're replacing, how you're cleaning, and all those things. That is very important. And nowadays, sometimes it's lacking, I see. You know, we never got marks. A procedure of cancer, if the right places में सामान नहीं पहुंचता था. Our teacher used to go every place. Kidney patient कहाँ रखा है? Where have you disposed? You know, how you, whether you have cleaned the trolley after using it. You know, all those things. So simulation required, because these are expensive efforts. Every institution you break something, they cannot keep buying it. Management cannot keep buying it. So we have to be very careful. So one-time investment is there, funds are needed, but we have to take care of it. And also this, I think all three of us have shown us 50% of ratio that's going to get, you know, that you have to have the simulation. And it's going to come with the regulation. It's going to, I think, change in INC curriculum also, syllabus also. We have to have this. And soon when I think the next provision is there, we can see that it is mandatory. So before it is mandatory, why not get ourselves, you know, ready for it and equipped for it. Now, simulation, evidence-based practice. You know, I was preparing for this. I saw so many articles, so many reviews. You know, meta reviews are there where you can see that meta-analysis studies are there. And they have said, like, every area that nurses have always felt. I'm not going to go through each one, but I'm just going to tell you that whether it is OBG, whether it is, you know, pediatric or any other field, students have felt more confident by using simulation. So results, the research have shown a good result. What else do we need? We always talk about evidence-based practice in nursing or any medical health sciences. So when we have so much evidence already, what are we waiting for? Why can't we just do it? You know. Next one. So again, efficacy of simulation program. I told you pediatric. Previous one was OBG. You know, and everybody, wherever the studies have seen, they have seen a better outcome. In nursing or in medical, we say that our main focus is the outcome. You know, what is the good outcome for our patients? Our focus is on patient. And the study has shown that it has improved. You know, Nursing Education Journal also, they have said that there are so much benefits, cognitive and clinical competence. These are the two pillars for nursing. Okay, so nursing, if you want to be competent and you want to be knowledgeable, these two things, you know, that anyway will improve the patient outcome. And that we can get through simulation. And here, this was a multi-sited study about end-of-life care. Okay, where it was done in 336 nursing students participated in simulation. Simulation training in the hospital. And they found that the significant increase in knowledge, self-confidence. Confidence is something. You know, sometimes we say, अगर आप confident हो, अगर आप गलत भी बोल रहे हो, तो लोग उसे सच समझते हैं. We don't have to fool people like that. But what I'm saying is that nursing में, you know, that is one thing I have seen lacking in us. We get educated, we do PhD, we do a lot of studies. You know, but I think that confidence comes जब हमारा skill, जब हमारा knowledge, when we can stand in the rounds. I go for rounds and I see nursing students and even the faculties at the back. They don't want to come with doctors for rounds. Why? Because they're scared कि कुछ पूछ लिया तो हम बता नहीं पाएंगे. कुछ करने को बोल दिया तो हम कर नहीं पाएंगे. So they are at the back. So that is why we don't want to. We have to be there in the front line. We are called front line health workers. फ्रंट लाइन का मतलब ये है कि जंपिंग हैंड, वी हैव टू बी मूविंग विद द टीम, और वो तभी आएगा जब हमारा कॉन्फिडेंस की अच्छा होगा, जब हमें पता होगी सब आता है तभी तो हम आगे बढ़ेंगे। जो बच्चा नहीं सीखता है वो सबसे पीछे शायद बैठना पसंद करेगा, मैम ने पूछ लिया तो डांट पड़ जाएगी, जिनको आता है वो सामने बैठ जाते हैं। So that is why we need to have a confidence, and our confidence will be boosted up only when we have good competency in nursing. And basically, I have found many study for UG, students, undergraduate students who have, like, I feel that it should be introduced in our first year, first year BSc or GNM or whichever course, the foundations of nursing to be built on simulation, So UG students में ये भी दिखाया है कि they have done extremely well with the simulation. So to conclude I'm not seeing anybody sleeping. I'm thankful to you all that you are still awake. To conclude my session, I would just say it's a rising need in nursing, and I'm so glad again that DP ma'am and the management of this institute has seen this need and done this workshop, and I'm very happy that I could be a part of it. And simulation is safe for students. It's a good news for students. It's a good news for faculty and us also. And also it requires a careful, thoughtful approach to ensure success for both students and faculty. And of course, as a whole, wherever you are, you will shine with this. Thank you very much. I request ma'am to conclude the session.
नमस्कार, अभी भी है जोश? जोश है? भी है ना? Now shall I come back? They are ready to listen. So, ma'am, you taken your session very short and sweet, and you comprise all the things. What are the role of nurses in simulation? मॉर्निंग से आप लोग सिमुलेशन पढ़ रहे हैं। अभी मैं कुछ बच्चों का फीडबैक जरूर लेना चाहूंगी कि क्या आपने कुछ सीखा, एनीथिंग न्यू, आपने कुछ नया सीखा आज? आवाज नहीं है। इससे पहले कितने लोगों को सिमुलेशन के बारे में मालूम था? थोड़ा बहुत रेज योर हैंड्स। कितने लोगों को सिमुलेशन के बारे में मालूम था? थोड़ा बहुत। एक्चुअली ये मेरा फीडबैक है, आपका नहीं है। दिस इज माय फीडबैक कि हमने ये टॉपिक को चूज किया है, तो हमने आपको कुछ दिया। इतना दूर आप चल के आए, इतना पेन लिया, मॉर्निंग में 4 बजे बस चल दी एसआर की, है एसआर वालों की बस 4 बजे चली, उस पांचवी वाले कल ही चले, ऐसे बहुत उन्नाव वाले भी सुबह सुबह चले होंगे। पेन लिया ना आप लोगों ने, तो आपको कुछ मिला है यहाँ पे? You learn anything? What? Simulation. So I think आपको ये understood है कि there is a role of nurse in simulation, and simulation is also very important for nursing. Yes? जो हमारे पास जितने भी कॉलेज है, I think 8 colleges are inside. किसी के पास कहीं से 56 है, किसी से 78 बच्चे हैं, कहीं से 15 है, कहीं से 10 है, कहीं से 2 है, कहीं से 1 like this. And nearby 8 to 10 colleges are in and others are online. Yes? So it was benefited. It was benefited. आप आज यहाँ पे जो पढ़ के जा रहे हैं, क्योंकि अभी तक आप लोग सिर्फ पढ़ाई के सेशन में थे। First session was what was simulation, then what are the new trends and what are the role of nurses in simulation and what is the role of simulation in nursing. Both are important subjects. अभी बाहर कुछ सेक्शन लगे हुए 3 सेशन आप लोगों ने देखे? क्या है वो? क्या है? सिमुलेशन नहीं है। क्या है? स्किल स्टेशन। स्किल स्टेशन है। मैडम ने आपको बताया था there is a difference between simulation and skills. स्किल्स को हम लोग उस पे यूज करते हैं ना। बाहर जाके एक एक हाथ, वो कहते हैं ना हाथ साफ करो वाला, किसी ने बताया था स्पीकर ने, एक बार जरूर आप लोग जाकर एक बार स्टेशन में देखिए कि कैसे हैंड टू हैंड हम लोग प्रैक्टिस कर सकते हैं। ओके, सो आई होप आप लोगों को बहुत अच्छा लगा समर्पण में आके। अच्छा लगा? आप दोबारा आना चाहेंगे? If we have another conference that is in forensic nursing, कोशिश करें आप लोग आए। Already more than 200 registrations are done. आप लोग कोशिश करें आए। फोरेंसिक भी एक बिल्कुल हॉट टॉपिक है नर्सिंग। Simulation is very hot and burning topic. फोरेंसिक also भी इंट्रोड्यूस हो गया है ना? उसके बारे में भी आप लोग जाने, बहुत लोग कोर्स में होगा, बीएससी के कोर्स में है ऑलरेडी। आप लोग कोशिश करें आने की, है ना? और 2-4 बच्चे मींस 1 students from each college, please give your feedback by coming on the stage, please. So first I will invite Pushpanjali College of Nursing. कहाँ है? अच्छा, एसआर से आ जाए। एसआर से फैकल्टी भी है हमारे पास। We need feedback online, please. तो जब तक आप लोग कर रहे हैं, we'll try. I will call to Jagdish sir for the feedback. आइए सर। हरिश्चंद्र कॉलेज के आप भी रेडी रहिए। 1% from each college. Sir, please. I welcome you on behalf of SAMARPAN. Just leave your
Dr. Shankar, Dr. Shweta, all the invited faculty and students. It is a privilege to be a part of this workshop today. Simulation in nursing is the need for the art which has been enlightened by every one of us. And thanks to Dr. for organizing such a wonderful workshop where you have organized even the skill station, which is going to be really helpful for all the students. We hope we will associate soon and make many more programs like this. Thank you for giving us.
Thank you so much. It was all of a sudden I have seen you in my office. Sir भी आए हैं. Thank you so much for coming. अच्छा, माइक पहुंच गया है? माइक आ गया है आपके पास? प्रतापगढ़ से कॉलेज है यहाँ पे, हरिश्चंद्र कॉलेज ऑफ नर्सिंग। आप बता दीजिए सर को कि कोई बच्चा बोल नहीं रहा, आए नहीं मेरे पास। सर्टिफिकेट विल बी होल्डेड। एसआर से बोल रहे हैं। अरे वाह, एसआर से बोल, हमारी पीजी पे आज बैठे। आइए, आप वहां से भी बोल सकते हैं, हमारा कैमरा घूम गया है, आप बोल दीजिए, आपको ही फोकस है इस समय।
मैं हॉस्पिटल एंड मेडिकल इंस्टीट्यूट की छात्रा हूँ। मैं बीएससी नर्सिंग 3rd ईयर की छात्रा हूँ और आज मुझे यहाँ के बहुत ही अच्छा लगा। हमने बहुत कुछ यहाँ पे सीखा। हमने सीखा कि एक्चुअली हम जो आर्टिफिशियली सीखते हैं उस चीजों को हम कैसे रियलिज्म में करते हैं, जैसे उसे कन्वर्टिंग करके हम उसे सीखते हैं। एंड देन सेकंड वन, बहुत सारी चीजें सीखने को मिली, जैसे हम डिफरेंट जगहों पे जाते हैं तो वहाँ पे हमें लैंग्वेज का नहीं पता होता है कि हम मतलब जैसे कुछ नॉलेज तो होती है कि कौन कौन सी लैंग्वेज वहाँ पे बोलनी है, बट हमें पता नहीं होता है एक्चुअली, जिसकी वजह से वहाँ हमारा एडजस्टमेंट नहीं हो पाता है। तो लैंग्वेज का जैसे आपने बताया कि लैंग्वेज की बहुत ज्यादा वहाँ पे स्पेशलिटी होती है, तो लैंग्वेज होना चाहिए, अच्छी होनी चाहिए। और जो भी चीजें मैम हमारे यहाँ हमारी जो फंडामेंटल लैब है वहाँ पे भी जो आपने बताया फैमिलिज्म का, वहाँ पे दिन मालूम नहीं है, जिसके बारे में हमें स्टडी कराया गया। और हमारे प्रिंसिपल से रिस्पेक्टेड मिस्टर सुमित प्रजापति सर ने, उन्होंने भी हमें फॉर्मुलेशन के बारे में कुछ बताया है। तो यहाँ पे आके चीजों को सीखने को मिला, उन्हें कैसे रिप्रेजेंट करते हैं ये सीखने को मिला, और बहुत सारी चीजें मिली मैम, बहुत अच्छा लगा यहाँ पे आके। थैंक यू सो मच।
नेक्स्ट कॉलेज उन्नाव सिंह कॉलेज है आप। Please hold the certificates if they are not here. सर्टिफिकेट भी इम्पोर्टेंट है ना, 2 क्रेडिट पॉइंट्स। अजय गुप्ता जी का भी कॉलेज से है ना? अयोध्या से कौन है? मैं फैकल्टी भी बोल सकती है, ऐसा नहीं है। फैकल्टी बस ये मत सोचिए स्टूडेंट, फैकल्टी देखिए माइक इनको दीजिए माइक। हाँ मैम को दीजिए। मैम आप किस कॉलेज से?
IIMS नर्सिंग कॉलेज से अयोध्या से।
देखिए जय श्री राम बताएं।
First time good evening to all of you present here. Myself is Krishna और मैं IIMS नर्सिंग कॉलेज में अयोध्या से हूँ। मुझे यहाँ पे आकर बहुत अच्छा लगा, बहुत बड़े सब लोगों से मुलाकात हुई। मेरी मैम सरिता मैम और संतोष सर से भी मेरी मुलाकात हो गई, और इसके बाद मैंने बहुत सब कुछ सीखा। और सभी बस मैंने स्किल्स और सिमुलेशन में डिफरेंस जो था ये मुझे नहीं मालूम था, इसको मैंने यहाँ ही सीखा और बहुत अच्छा लगा जो कुछ सीखा मैंने यहाँ पे आकर। और मैं ट्राई करूँगी कि मैं भी ऐसी आपकी अटेंड करती हूँ। थैंक यू सो मच।
Thank you so much. Yes, someone is asking for mic. ये ग्रीन चेक, ग्रीन चेक। हाँ बेटा बताओ माइक दो। हाँ हाँ इसीलिए मुझे दीप्ति नाम बोलते हैं। कहाँ से आए हो और क्या सीखा?
Myself, Jyoti Messi. I am from BSc Nursing third year. It was a very nice experience in this college, and I feel very proud to be here. And I feel very lucky to be here. Like I got to know about things which are really matters in the future. So, ma'am, it's one honorable for me. And
third year is I think 90% based on simulation now in these days, and the message is there.
Yes.
So I wish you could learn something from here, and definitely it's going to work out in your life. Thank you so much for sharing your. Yes. Next. Hardoi. Hardoi.
A very good afternoon to all of you. मैं सेंट मैरी की छात्रा। मुझे सच में मैम यहाँ की बहुत अच्छा लगा, क्योंकि यहाँ पे ये चीजें हैं कि हम अपने स्किल को, नर्सिंग प्रोफेशन को कैसे और मोर डेवलप करें, न्यू स्किल्स को कैसे सीखें, ये चीजें मैंने यहाँ पे सीखी। और मैम हमें अपने लीडरशिप को कैसे हम अपने लीडरशिप को बिल्डअप कर सकते हैं, नर्सिंग प्रोफेशन को आगे बढ़ाने के लिए हम क्या क्या करना चाहिए, ये सारी चीजें मैंने सीखी। सच में मुझे यहाँ आके बहुत अच्छा लगा।
थैंक यू सो मच। यस गुप्ता, पुष्पांजलि गुप्ता से बोलिएगा, कोई नहीं आया उनके पास। और कोई कॉलेज छूट रहा है वहाँ पे अंदर? See, मैं इसलिए बोल रही हूँ, when you will give your feedback, your college is going to be mentioned in online also. So this is a proud for a college too.
Good evening everyone, faculty and students. Very good evening all of you. मेरा नाम दीपाली मंडल है, from Anchorite International Institute of Medical Sciences, Lucknow. जैसा कि हम सभी को बहुत ही बड़ी अपॉर्चुनिटी मिली है कि हम सिमुलेशन के बारे में कुछ सीख सकें, और यहाँ आकर के इन लोगों ने बहुत ही अच्छा सक्सेसफुली हम लोग को एजुकेट किया है इस टॉपिक के बारे में, और हम आगे चल के इस चीज को अपने एजुकेशन में और अपने फील्ड में इसको इम्प्लीमेंट करेंगे और इसका यूज करेंगे।
थैंक यू सो मच। थैंक यू। अजय कीर्ति सर के कॉलेज से कौन है? हाँ हाँ दीजिए दीजिए, कॉलेज का नाम जरूर बताएं।
Ma'am, my name is Aman Nasi and I am from St. Mary College of Nursing. Ma'am, we are feeling very honorable to attend your workshop, and ma'am, we learned that rather than experimenting on the real life situation or the real human beings, we can learn on the simulations, and then in future we can try it on the real life situation. That will support and protect the ethics of the human beings.
Yes, yes, very good. Thank you so much. Thank you. Okay. So thank you so much for sharing your views for today's workshop. Means a lot. बहुत सारे लोग अच्छा बोलना हाँ.
Good evening, everyone. My name is Priyanka Daniel. I'm representing SAMARPAN College of Nursing and Paramedical Sciences right now. And we are very much thrilled and we are thankful that we could attend this workshop. Thank you so much, Deepti ma'am, for organizing such a wonderful workshop on stimulation and nursing. And we really learned a lot of new things. And thankful to all the facilitators, especially Dr. Anugrova ma'am, Dr. Biman Joy sir, and Professor Priscilla ma'am. Thank you so much for facilitating us with your knowledge and wisdom. Thank you so much, everyone.
Thank you so much. Convey my regards to Rosie ma'am. Thank you so much. So, over. Yes. So it was really a wonderful experience to have you all in Samarpan. आप कह रहे you feel proud. We feel proud to have so many people from different places in समर्पण. आज अच्छा लग रहा है आपको बताना कि समर्पण एक नर्सिंग कॉलेज है यहाँ लखनऊ में. हम लोग इस तरीके से थोड़ा बहुत नर्सिंग के फील्ड में आगे की तरफ काम कर रहे हैं. मुझे बहुत अच्छा लगा. I feel so proud कि आप लोगों ने सारे पॉजिटिव वाइब्स हमको दिए. और ऐसे ही हम लोग आगे भी कुछ ना कुछ करते रहेंगे. रणवीश आप लोग हमेशा हमारे पास ऐसे आते रहेंगे. Thank you so much for coming. So today, now we are going with the national anthem. I request everyone to please stand up. पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे. Thank you, Jai Hind. So today is the time for the tea. आप लोग चाय के साथ साथ स्किल स्टेशन पे वर्कआउट करके अपने सर्टिफिकेट लेकर के जा सकते हैं. थैंक यू सो मच. इसलिए कह रहे फिर आना पार्ट को है ना. थैंक यू सो मच. आप एक वीडियो वहाँ का भी इसी में ऐड कर दीजिए यूट्यूब नहीं तो हम दिखा दीजिए थोड़ा सा ये किसका
हमारा ये इंडेक्स पे जाना नेसेसरी है, रिमूव करके कभी उसका पर्टिकुलर एक्चुअली हमने ऐसे की थी तो हम आपको यहाँ पे करके रिमूवल का है नहीं, ठीक है। अभी हमारा इंसर्जेंट का हो गया हमारा चिप को चला गया और उसके बाद फिक्स किया। चिप फिक्सिंग के बाद क्या करेंगे, हम कनेक्ट कर देंगे। ठीक, आईवी जो है हमारा आईवी लाइन जो जा रही है हमारी वो हम कनेक्ट कर देंगे।
जो भी एडवाइस है फिजिशियन द्वारा भाई इंजेक्टेबल होगा, हो सकता है इन्फ्यूजन हो, उस हिसाब से हम कनेक्ट
कनेक्ट कर देंगे। उसके बाद क्या करना होता है हमें, आर्टिकल हमारा कन्वर्जन पूरा प्रोसेस खत्म हो गया है, कितना जो हमारा पेशेंट के पास ओवर हो गया। अब हमें क्या करना है,
प्रेस करना होता है और क्या करते हैं 1 मिनट में 100 टाइम देना होता है, ठीक है। तो हम लोग को 10 सेकंड के लिए देना है, तो 15 कंप्रेशन रहेगा और 2 ब्रीदिंग रहेगी, ठीक है। तो हम लोग कुछ करना नहीं है, 2 टर्म लेने हैं, हाँ सॉरी 2 फिंगर लेने हैं, ऐसे कंप्रेस करते रहना है, ठीक है। 15 टाइम्स करना है, फिर उसके बाद क्या करते हैं, दो ब्रीथ देनी है। फिर ये होगा, अगर 20 मिनट्स तक हम ये करेंगे, 20 मिनट्स तक भी अगर ये एयर वे मेंटेन नहीं होता है तो हम लोग को हायर और एयर सेंटर में इसको भेजना है।
और जो हमारा येलो है उसमें क्या यूज जो ब्लड से करते बॉडी पार्ट्स होता
से कवर कर लीजिए।
मैक्सिमम